Oh, yeah.
All right, now I know you. I can hear myself in this building, so for my guys over there, are we live? Hello? Yeah, so we're on the screen. Whoever's out there is watching. Well, we are in a fabulous new facility, and we will talk a little bit about that when we reconvene at or about 12 o'clock for our open session. We are going till 12:30 is when we plan to reconvene. So I am calling to order the August 21st board meeting of the Covered California, and I will call the roll. Belcher?
Here.
Führer?
Here.
Dooley is here. Führer is very close. Kennedy is very close to arriving. Dr. Ross will not be with us today, so we will be a panel of 4. Are there any conflicts that anyone must disclose based on the posted agenda? Seeing none, we will be meeting in closed session for approximately 2 hours, 2.5. We expect to be back reconvened in open session about 12:30. We will be meeting under the government code, appropriate government code sections related to contracting and personnel and administrative litigation matters. So with that, we will be in closed session, and we'll see everyone back at about 12:30. Thanks. Good afternoon. Oh, this works pretty well. What a nice setting. It looks so different. You all seem so much further away. I've gotten kind of accustomed to having a little more intimacy with you. I apologize. The last several meetings, you'll know, we have really started on time. In fact, sometimes we've been here advance of the time, but today we ran a little bit over, so we're starting about 15 minutes late. But I'm very happy to welcome you here to our new facility. We did a ribbon cutting here a few months ago, and they have settled in, and this auditorium will be our new home for board meetings. So welcome. I hope you all got in and situated easily. We convened at 10 o'clock and called the roll, and you'll notice Dr. Ross had a previous commitment for this meeting, so he will not be with us. We took the roll. There were no conflicts to disclose based on the agenda, so we will now take the minutes that have been noticed from the May 22nd meeting. And ask if there are any amendments or corrections or additions from anybody on the board.
June.
Excuse me?
June 19th.
Well, I thought that was June, but this one says May, so it's. I paused there. Okay, that we have the right minutes in there, the June minutes. So,
I
yes.
just have a tiny question.
Sure.
And I don't know if this is something new or not. I just noticed that in terms of all the public comment in this version, it only lists names. And it has nothing about the
Affiliation?
No, the substance of the comment. Maybe that's new. I don't know.
That's actually not new, and we will revert to actually providing some sense of what the comments were. We never get them verbatim exactly right, but do note that there is that in this set of minutes we know exactly how many minutes they spoke, but not what they said.
Right.
And I think it's important to have the flavor of the minutes that would give more of a flavor of what they said. And Ms. Ravel will address this issue directly, who is speaking at the podium, which 1/3 of you cannot see when she's at the podium, but we're still working out these issues. Ms. Ravel.
Let me just shout, we will provide this version with the comments the way they usually are.
So you press the button there that has the little speaky face. There you go.
Thank you.
So easy a child could use it. We'll provide an updated version with the actual comments like we usually do.
So I would actually suggest that we carry this over to the next board meeting, so if people do not feel that their comments were reflected, we could act on it. Because again, it's an important piece. Many people do look at these issues. So I would actually suggest we carry this forward for next meeting when people can have their comments reflected.
Good. Nice
Thank you,
catch, Paul. So this item will be deferred, and I won't be taking public comment. Before I turn the meeting over to Peter for his report on the closed session and on the executive director's report, I want to take an opportunity to recognize the work that Peter has done and share a little bit about our process. We've all worked to get process in place over these many months, and Paul Farrer and I have been the subcommittee of the board that is the personnel committee. And part of our responsibility has been to review the salary surveys that were done at the outset that established the first salary ranges when we created the exchange, and how the work we're doing now might relate to other comparisons both in public service and out of public service. And we've been working on this project now for about 18 months, and there have been a number of complications, but what we realized in the spring was that by not having completed it, and by having some minor staff adjustments with the cost of living that has come through the budget, we have not adjusted Peter's pay since he started 3 years ago, even though it was our intent to have done that before now. So we took an interim step in June at our board meeting to make an incentive payment of 20% to Peter in recognition of his leadership and the work that he has done. We sent that out through Cal HR to be sure that we were doing it consistently with the state rules about incentive payments for those state departments that do provide incentive payments. And so that has all been resolved, and I am pleased to say that effective in July, Peter was awarded a 20% just a lump sum payment. We haven't changed his base. We're going to do that when we look at all of the work, but it's some way to show our recognition, and thanks, Peter, for the leadership you've provided and the work, the good work that you've done that has brought us to this point. So on behalf of us all, thank you very much.
Thank you very much for that acknowledgement and that recognition, and it continues to be a real privilege to serve in this role and work with not just this board, but thousands of people across the state of California that are doing incredible work. So thank you very much, and I'm starting the meeting blushing a little bit. Before I go into the closed session and the executive director's report, I want to join Diana in welcoming people to our new permanent home. And I want to do that with a very quick set of thank yous to some people that made this possible. Now, this is our first board meeting here on Exposition Boulevard. We'll have many, many more. We'll be working through little glitches as we go to maybe bring the chairs up a little closer, have the thing so you can see things behind the speakers here. But I want to do a couple acknowledgments because, as you all know, over the last 2 years, Cover California has been focused on California's consumers, on rolling out the biggest expansion of healthcare in partnership with DHCS, with thousands of people. And at the same time as we've been doing that, we moved lock, stock, and barrel from J Street over here to Exposition Boulevard. And I want to acknowledge the many staff at Cover California, in particular in business services and IT, who made this happen. Becky Patchen and her staff at business services did everything from pre-construction planning, modular systems, building oversight, to a workspace that I think, and you should talk to our staff, really provides a really great workplace with a lot of natural light, a lot of good meeting space. Julie Baker, Brenda O'Brien, the IT staff did a huge lift while managing the day-to-day operations, moving us from J Street, but also switching over so our day-to-day IT is something that's on our own servers, not having to piggyback on DHCS's servers. We've had a great partnership with the Department of Healthcare Services, continue to, but on some cases we stand on our own, and this is an area that IT helped do that. The staff from the Department of General Services, and in particular Sally Morphus, George Corello and Heather Boyd are people that don't work directly for Cover California, but work their butts off to look at sites that would be available to get us in to this space in a third the time what's normally possible, to build it out. So we may have had hiccups and glitches along the way of our rollout. It wasn't because of the move. That happened smoothly, it happened well, and I want to welcome you all here to our new space. So thanks to all of those who made this possible. We hope the space works as well for you as it is beginning to work for Cover California. So let me now turn to the updates. Now let me see, does this work? Yes, it does. Announcements. Okay, so let me go through closed session items. And first, on personnel matters, I'm very happy to announce 2 new appointments, and I believe they are both here, and I would ask them to stand as I introduce them. Is first the appointment of Amy Palmer. Amy so those that know Amy are already applauding. Amy is joining us as the Director of Communications and Public Relations. Amy has a broad background in communications, public relations, journalism, including from 2007 to 2011 serving as Associate Secretary of External Affairs for the California Health and Human Services Agency. We're thrilled to have Amy joining us. It's obviously we are all about communications, and she's going to be a great member of the team. Welcome, Amy. Second, thrilled to note the appointment of Kirk Whalen. Kirk? Next month, Kirk will appear. Thank you. That was not Kirk projecting that Kirk will be able to be here in person next month, but Kirk will be joining us as the Director of Individual and Small Business Sales. As Director of Individual Sales, Kirk's going to be providing executive leadership to sales, execution. You know, we are a program that has substantial subsidies, but in the end, we need to sell what we do. We need to work closely with the agent community, with the ground folks in community organizations, in clinics. And Kirk comes with us with an 18-year history of working on sales in the individual and small group market, working most recently with Kaiser Permanente, and we look forward to the skills that he's going to be bringing to Cover California and to our mission across the state. So we're thrilled to make those 2 personnel announcements that was acted on by the board at this meeting. So that's it. You'll meet him next meeting. On several contracting matters the board acted on is first, the board acted to augment the contract with Weber Shandwick on marketing and advertising sales. At the last board meeting, the board approved an expansion of our marketing budget, and this augmentation is actually have the resources be targeted to meet the budget we're going to spend on marketing. So we needed to augment and revise that budget. We extended the contract with National Opinion Research Center. We extended the contract with KP Corporation for collateral materials. We extended the contract with Richard Heath and Associates. And I want to underscore this one. I don't know if are some of our partners from Richard Heath and Associates here with us today. I want to note a couple things. We talked a lot in the months leading up to adopting our budget about our desire and need to get more money on the street, to effectively and efficiently oversee our contracts, our partners. Richard Heath and Associates has been one of our core partners, and with really phenomenal leadership on our team, from Sarah Soto Taylor in particular, and Mary Watanabe, we've worked with Richard Heath and Associates to actually reduce the scope of their contract by $10 million over the period of their contract. We're extending the time period, though, and they will continue to be our partners in working with administering the Certified Enrollment Counselor Program, the Outreach and Education Grant Program, and the Navigator Program. But in doing that contract restructuring, it's one of the things that enabled us to have the $17 million Navigator program that's going to put more money in community. So I wanted to a particular acknowledgement and thank you both to our team for launching and building on this important community-anchored work, as well as to Richard Heath and Associates as we worked with them to continue to deliver good oversight services. The board also revised our contract with Equium Technologies. This was a contract that was adopted at the last board meeting, but this is a technical amendment. On service center issues, the board approved 2 actions. As we look ahead towards open enrollment, we expect to have a lot of calls, a lot of paper, a lot of work going through our service center. The board authorized Cover California to re-enter and go back to seek to negotiate an extended contract with Contra Costa, a partner we've been working with over the last year, and authorize that to potentially extend that contract for another year. but also authorize staff to solicit and contract for short-term contracting for services during the peak period of open enrollment. We will be, and you'll be hearing more about this in our update on Service Center, have every single one of our seats filled in Fresno, in Rancho Cordova, and around this office. Even with that, we will have needs for more people on phones at peak time. And so we're looking at having short-term contracting to allow for that capacity, to fill that need both for phone and paper processing, and we'll be issuing a competitive solicitation to select vendor or vendors to fill that short-term need. On the CalHERS front, a number of contracting matters were taken up, including an extension and augmentation of the First Data Government Solutions contract, which is for business and analytics support for the CalHERS program. This is in particular to provide work in partnership with the county partners through OSI and for general quality oversight of the CalHERS program. The board approved an extension and augmentation of our contract with Vision Integration Professionals, which provides our regular ongoing oversight of the independent verification of the build-outs of CalHERS. And finally, the board approved exercising an option within the CalHERS contract with Accenture that was provided in the original contract for integration with health-related programs. That was an option that was extended. We were going to exercise that option. We are not going to exercise the contract option for horizontal integration, because instead of that, we are going to move forward with horizontal integration, but with a separate change request, which our staff and in partnership with the Department of Social Services and Department of Healthcare Services advise that we can do it fiscally more sound, but it is not a change of policy, rather the mechanics of moving ahead with horizontal integration. Diane, is there anything you want to speak to on the horizontal issue? No. Okay, great. The board also received updates on some pending litigation matters. So I want to briefly review the agenda. We have a surprise, full agenda. For many of us, having a month off from having a board meeting, with all due respect, was not a bad break. But it doesn't mean we were able to take a holiday. We have a lot going on. I would note that after the Executive Director's report, which is going to speak in particular to covering an update on our health plan contracting, as well as the potential implications of Prop 45, in the policy and action items, we look forward to providing a report from the Kaiser Family Foundation on their recent survey of previously uninsured individuals and how they're experiencing the potential of getting coverage in California, and an update on the lessons learned for open enrollment. I would note that we do look forward to releasing a report on our open enrollment activities. We've been working closely with Deborah Kelch, and she's been a great partner. That report should be coming out in the next weeks. But you'll be hearing today on what our lessons have been and how we're applying those lessons to our marketing, outreach, customer service, and IT plans and renewal plans for the upcoming open enrollment period. So with that, I'd also, as I often do, highlight now, most of you are more electronically enabled than I am. I still go with paper. The reason not to go with paper is it's a lot, but we post thank you, Diana, the dozens of reports that we share and commend to you. I would highlight a couple things. We have 4 or 5 reports that we posted relate to lessons, not just in California, but across the nation, of what's worked and what didn't work in enrollment, outreach, and education. We look at those reports as well as we're looking at California's experience. I would commend them to you. Second, there's a number of reports we've shared that relate to benefit designs. Robert Wood Johnson looking at comparison of cost sharing of children's health programs versus exchanges. A program from another Robert Wood Johnson on comparing cost sharing amongst exchanges. These are good material as we get ready, and you'll hear more from Ann Price, who I'll be introducing shortly as our new Director of Health Plans, first time she's at a board meeting, to talk about our efforts coming down the track on benefit redesign. The other thing I would note in our material that we share with you is material from the field poll. Earlier this week, the field poll released their survey of voters. Diana Dooley and I had a chance to be part of the release of that information. There's a lot of information in there, but I would call out two particular data points from the field poll. One is that by a 2-to-1 margin, Californian voters think that we've been successful in launching the Affordable Care Act in California. And in many ways, that's relatively successful. It's not 100%. And in many ways, I think it's a fair grade by voters in California. We didn't do things perfectly. And we were overall successful, and we have more work to do. The other data point that I'd note that I think is very encouraging is one of the questions the field poll has asked for the last many years is, how are voters' satisfaction with the healthcare system and how is it working? How satisfied are they? For the last 5 years, there's been no change in that until last year. So for the first year in many years, and this is the first year in which the Affordable Care Act, of which Covered California is a part, is being implemented, there's been a significant increase in consumers and voters saying that the healthcare system is working better. All of our work is about coverage, affordability, prevention and wellness, and changing the entire healthcare system. I think we can all take some pride and satisfaction in seeing what I think all of us hope will be an ongoing inflection point with the implementation, and not just talking theory about the Affordable Care Act, but the actual implementation. People across California are experiencing a healthcare system that they're more satisfied with. And I think that's a striking thing. I think we all hope that trend will continue with that inflection point. Finally, as we always have in our board material, we have comments received. We have comments related to Prop 45. We have a range of comments from elected officials that we've responded to, a number of comments from individuals with regard to essential community providers. And these are important comments. We and the board look at them. Many we respond to specifically and individually, but I think they all provide an important texture of the work we do. So before going into my standard report, I want to call out a couple of items that are in the appendix to the executive director's report. We have a lot of things going on. And I just want to highlight a couple of things that are in the appendixes. First, Covered California has been making payments to our certified enrollment entities. We've been playing catch up, but we report on the number of payments made. Many of those payments have been going out, and we are working with the Department of Healthcare Services, which has been making payments for certified enrollment entities for Medi-Cal enrollment. We look forward to making payments to agents for their enrollment of Medi-Cal individuals, and one of the things before the board today is amending the contract with agents to make those payments possible. We provide an update in the appendix to the very strong response and interest in the Navigator program. And again, I want to commend both Sarah, Mary, and the team at RHA, but in particular, hundreds of organizations across the state that want to continue to be part of the efforts to get Californians covered. Over 140 applicants have applied to potentially be navigators. We're in the process of reviewing those grants. The requests came from across the state, targeting all of the core subsidy-eligible individuals that we want to get insured. And it's good news. The outpouring of interest, though, I would note, means that only 25% of the funds requested we will be able to satisfy. Over $65 million of requests have come in. We have $17 million available. And again, it's a good news, bad news. It shows the level of interest, commitment, and desire across California to get people covered. But it's also a reminder that we will always have more demand than we will have resources for. We will take the lessons from this round of the Navigator program as we look into round 3 of open enrollment. But we are thrilled to see the amount of interest, and we will be doing the review and announcing the selected entities in early September. And our selection is going to be based on those that are targeting subsidy-eligible Californians, based on region, where they are, and the quality of their proposals and how they show that they'll deliver on them. We provide an update on the continued releases to CalHERS. CalHERS continues. As you all know, it's a partnership venture with the Department of Healthcare Services. There have been substantial improvements made in CalHERS to address both Medi-Cal processing as well as building for the second open enrollment period and the renewal, both for Covered California individuals and Medi-Cal beneficiaries. And finally, I want to note some of the updates in our material on our service center. We've been staffing up. Some of that staffing up has been specifically seeking to address issues of having more bilingual staff. I'm thrilled to note that since July 15th, 70% of the service center staff we've hired are bilingual. 65 new bilingual staff, which are joining the 75 existing bilingual staff. Service levels, I want to address that, and this actually foreshadows the next topic I'm going to come to, which is on our work on inconsistencies, is in the months of May and June, we were surpassing what is our target for service levels of 80% of the calls answered within 30 seconds. We have not been meeting that in the last month. We've been way short of that. And the reason we've been way short of that is that we've been taking people off the phones. They've been off the phones to be processing literally hundreds of thousands of background paper of work to make sure that people that have sent in proofs of income, proofs of citizenship, are properly uploaded so people's inconsistencies, part of our requirement, are appropriately cleared. As we get ready to staff for open enrollment, we hope to be back at that 80-30 rate, but that's a piece where we know that we have some work to do as we've been clearing that backlog. So the other thing I note in the background on the material is, once again, our continued very good partnership with counties. The work counties have been doing on the quick sort continues to be exceptionally good in terms of the response times they're having. When we do handoffs to counties, it is surpassing the 80-30 all the time. They are not, people that needed to get handoff to the counties are not waiting. They are getting handoffs that are clean, that are being picked up right away. So I want to note, while we have had first call challenges, because of taking people to do paper processing, that doesn't mean that people that are getting handed to counties have a second lag time. And that's really a tribute to the great work of the counties. So with that, I want to turn to another update before we turn to a couple other issues, which is on resolving inconsistencies. So as many of you know, but I want to remind you all, the eligibility for subsidies and even the eligibility for coverage through Cover California has a number of contingencies. Eligibility for subsidies is based on citizenship, immigration status, level of income. When consumers apply, if we can validate electronically their citizenship or income, we do that. We bounce up against what's called a federal hub, and that serves to verify the vast majority of consumers. Where that verification cannot be done, we need to, and we've reached out to thousands of Californians to say, we actually need you to provide proof of citizenship or proof of your income, a W-2, et cetera. The federal government is doing the same thing. The federal government will be, in August, announced that for about 300,000 individuals in the federal marketplace, they will be needing to send notices that they do not have their proof of citizenship. We are embarking on the same thing, in that we have cleared over 600,000 documents to clarify when people have sent in proofs of citizenship of income. Where we're moving to next, though, is in particular with regard to citizenship and immigration status, a process of clearing that status both when we can do it electronically, rerunning information against the federal hub, or where we have not cleared that, we will be doing a series of follow-up communications with what will be over 100,000. And I note the number without noting the exact number because we're still clearing the numbers, and when we have the final numbers, we'll announce the specifics. But to let individuals know they need to get us their information that confirms their citizenship or immigration status. We will provide multiple touches, multiple ways to affirm that. They will get both email and mail notices to provide that proof. If, however, individuals are not able to provide that proof by, and this will be in late September to October, we will have to terminate their coverage. This is not something we want to do, not something we plan to do with anyone. We hope it will have no one getting coverage canceled. And we have an obligation to make sure that only people that are eligible for benefits get those benefits. And this is a major venture. It's an important venture, and I appreciate the partnership we've had and embarked on, not just with the health plans, but also with certified enrollment counselors and agents, which will partner with us in reaching out to their individuals if those are some of the people for whom we need documentation. Let me pause to see if there are any questions from the board on that. And again, we're going to have an opportunity for consumer comment or public comment as we go through. But this is an important issue. And again, there's been a lot of discussion federally, but this is the first opportunity we've had since our June board meeting to bring this before the board.
Kim?
Thank you. That's right, Peter. This is not an issue unique to California, though perhaps a somewhat larger one in our state, just given our size. So the feds no doubt have given direction to states in terms of things they should be doing. Are the action steps you just quickly outline, are those reflective exclusively of what the feds are requiring us to do? Are we taking some additional steps that reflect our eagerness to ensure that we are retaining, giving these individuals as much opportunity as possible to provide the necessary documentation?
The federal government has been very clear that we and every state is required to assure people have demonstrated their citizenship or income. They have not prescribed how many touches we do that. We're committed to do multiple touches. And so reaching out by email, working in partnership with agents, working in partnership with health plans is something that I think is the right approach. How much is that more or less than the federal government is doing? I'm really not sure. We've looked at sort of best practices. The federal government's actually doing, I think, a good strategy of also having multiple touches. We've been on calls with the other state-based exchanges to share best practice strategies of reaching out ahead of time as much as possible. And so I think that we've got a good, solid approach that is taking the learnings both from what other states and what the federal government's doing. Any other questions from the board before I move on? Okay, thank you. The other thing I want to share with the board and with the public, and I know this says David Panish, but David can come up if there's further questions on this. I'm going to, in the interest of time, run through relatively quickly, is that we have a number of advisory committees. We have advisory committees specifically on plan management, on SHOP, and on marketing and outreach. But in addition, we've had a number of ongoing and ad hoc advisory committees specific with a number of ethnic groups, demographic populations. Advisory group that we've had on for the Latino community, African American, and Asian community. And we're actually, these are very important. They provide a sounding board, a forum for discussion of issues, and I think David actually will go up to the mic and say something in a moment. Or
no, but I just want to let you know we have 2 assembly members here that would like to speak.
on
But they have to leave at 1:45.
I can't seem to keep the microphone turned on. Assemblymember Brown and Assemblymember Bradford. Hello, Dr. Brown. Please come up. I realize that you have, this is a very busy time across, well, I used to say across the street, but now I have to say across town. And we welcome you here today, and we're so glad to have you and to welcome your comments. Thank you, Ms. Brown.
If it's all right, I'd
Yes,
like to
please,
start.
absolutely.
I'm sorry,
And
we do
Mr.
have
Bradford.
to.
Sure.
We do have, I think, a pickup in just a few minutes. But
Sure. Thank you. Welcome.
Thank you. We wanted to. The Black Caucus has some concerns, and the Black Caucus asked me to come and address this board today. First of all, I want to say congratulations that Covered California completed the first enrollment phase of the Affordable Care Act, and that you've reached 1.2 million eligible residents. There were a lot of questions and a lot of problems during that, but it was a tremendous accomplishment which your organization is entitled to take pride in. While we have great respect for what's been accomplished so far, I want to express profound and universally felt disappointment in what appears to be Covered California's lack of commitment to a comprehensive African American outreach. When the LA Times reported that Covered California did not meet its base projections with African Americans, but doubled its reach to other communities, the caucus was asked to intervene by various community leaders that described the outreach efforts to be thrown together and that they were disingenuous. I'm here today because there is frustration and a lack of trust with our community that could now make it harder for us to enroll African Americans statewide. After meeting with your staff, even I was given the runaround and told that it was not the truth about the media firm that was selected. The caucus is ready to intervene and use all the tools within our power to ensure that the community is informed about covered California. Based on your numbers of almost right at 89,000 eligible people who have not enrolled or been enrolled, and based of the complaints that we're hearing on the ground, to do that messaging and connecting the dots, using trusted messengers and no comprehensive plan that works. It didn't work before, and right now, as we see going forward, we don't think this plan is going to work. If penalties for this year take effect, African Americans will have to pay over $8 million in penalties to the IRS. And that's something that the Legislative Black Caucus cannot allow to happen on our watch. After Latino leaders raised similar concerns last year, Covered California developed a fully funded, comprehensive plan that drew both on the internal and external resources to boost the Latino outreach. That was wonderful. But given that Covered California had already established an African American advisory committee with advocates for the black community placed in their organization, we later learned that this group was only used to give an appearance of inclusion. As you know, Covered California is managing both the state's participation in Affordable Care Act, private insurance element, and expanded access to Medi-Cal. With that, there's a real danger of serious health consequences in the black community should you continue to minimize the importance of increasing the African American enrollment. From my understanding, these concerns have already been raised by a number of Covered California board meetings. At this stage, we believe we must intervene. This is an urgent matter because prior public information campaigns have clearly lacked insight to produce the necessary outcomes. And while I was told that a new media firm based in California was hired, I later discovered that Identity Media is a sister company to Weber Shadwick, and essentially that the entire caucus was not told the truth. From this point forward, it's essential that we work together to develop a successful outreach program of education and enrollment strategy that will help ensure that black Californians have equal access to these important programs. In a letter to Covered California from the California Black Media, they represented and presented suggestions that the Legislative Black Caucus supports in reaching the community. 1, issuing an RFP or subcontracting with an African American advertising firm with a proven track record of targeting African Americans. Allowing sufficient fiscal resources to reach and enroll the black community. Developing funding and implementing a comprehensive strategy to enroll 100% of African Americans in whatever program they're eligible for. We appreciate your attention to this matter, and we remain hopeful that the resolution can be reached in the near future. Thank you in advance for your time and for your consideration. And Mr. Bradford is the second person that will be coming behind me to talk about what he's done in this issue.
Thank you, Assemblymember Brown. Welcome, Mr. Bradford.
Thank you. My name is Steve Bradford, member of the Legislative Black Caucus in the California Assembly. And I'm just here because earlier this year, Ms. Brown clearly stated, we met with the board and our members of the board, Mr. Lee and Ms. Dooley. And in February, we expressed our concerns, our frustrations, our hopes for a comprehensive, real outreach program to the African American community. Even so, to the degree that I was asked to provide names of qualified firms. Prior to coming to the legislature or being elected, period, I spent almost 30 years of my life in marketing and public relations, and I understand the challenges of reaching diverse communities. And usually we see the same firms who claim to do it and really don't know how. When you showed us your list of media outreach and in the geographic areas that you're hoping to target, you had LA outreach with San Bernardino organized papers and things of that nature. And we were seeing San Bernardino is a totally demographic area from LA, and a media paper that's produced in San Bernardino doesn't reach people in LA. But we gave that kind of advice. We also saw the list of quote-unquote celebrity spokespersons that had been identified as, I guess, faces for this program. And I asked, well, how did you come up with this list? And I was told, well, they have a large Facebook and Twitter following. I'm pretty sure you're not using Facebook and Twitter followings to identify other ethnic communities. And all due respect to Russell Simmons, who's a very successful entertainment mogul, Russell Simmons could not encourage me to join anything as it relates to medical services. So, again, we suggested prominent names such as Magic Johnson, who's a key spokesperson. And if you poll Magic Johnson, he polls higher than most elected officials as being a credible spokesperson, not only in the African American community, but in most communities. And it was names like that was provided, as well as marketing firms. And again, the firms that you use, if you really do your homework, some of them have a non-urban dictate. That means they do not buy ethnic, electronic, or print media. It's no secret in the public marketing and public relations business of the non-urban dictate. And many of the firms that are constantly used to quote-unquote reach minorities, communities, that's their mode of operation. So we said just because you now go out and hire a firm that has minorities in it doesn't mean, again, they have the tools and the resources or the connections to reach that community. And I really wish, in all honesty, that there would be a real effort instead of the social lubricants that we see all the time being used to reach our communities. And I just have no other way to put it, because I'm offended. And again, if I hadn't had the experience and if I didn't have the contacts and I didn't take your directive honestly and do the homework to provide you with individuals who then told me they were never contacted. Never contacted. It's one thing to contact them and say, hey, there's no marriage here, it doesn't work, but you didn't even contact them. So again, I think it's a great waste of the caucus's time that we've met with you, we've shared our concerns, and it's a great concern to the community. I also chair the Select Committee on Boys and Men of Color, and we have gone all up and down the state, and one of the leading issues that many of these boys and men of color face are access to health care. And it's real, but we need a real program. We need a real comprehensive program to reach these boys and men and all segments of the community. So, again, we stand committed to work with Covered California, but Covered California has to be committed to real minority outreach and contact. So, thank you.
Thank you, Mr. Bradford. Thank you for your comments.
So I know that the assembly members cannot stay. We look forward to having more follow-up with them. We've had a number of very fruitful dialogues as part of our report, generally about the efficacy of outreach. There's a number of areas that I think we should all, in looking at the evidence of what communities have better knowledge, who have been touched and heard those contacts. We started last year with a broad strategy and a specific strategy for reaching Latino community, Asian community, African American community. And in many areas, the data is showing we did a pretty good job across those communities. And again, I look forward to sitting down more with the caucus to both get your specific suggestions on how we can improve, but also to look at where we have actually had some success, because the data is showing that in many cases we've reached across communities, not perfectly, but as well in the African American communities as other communities. And I think we have continued work to do. We look forward to working with the caucus and other partners. So thank you very much for joining us. Susan?
Yeah, I'm sorry. Was your response they're wrong?
Some of the issues of did we have a coordinated effort specifically to reach out to the African American community? We absolutely did. Our grants for open enrollment outreach included targeted grants, and by and large, the data shows that African Americans were.
I heard you the first time. I just think that our response to the members should be that we're going to look into it and take their concerns really seriously.
Absolutely. Absolutely. Thank you. Please. You need to press the button, I think, that has the speaky face on the mic there. There you go.
Okay.
Thank you.
I'm sorry. I know that Covered California made an effort, but when you tell people, first of all, the African American community was not important to Covered California, and they know that from the beginning. So whenever they knew that, and whenever the outreach went out, one of the young people that came to an event that Mr. Peter Lee was attending, they had this kid with with a child, and he had a white picket fence. And so this young man's the trustee down in San Bernardino of Valley College, and he said, why would you put something like that? No, people don't have white picket fences anymore. And the way that that's presented, it's like it's not talking or speaking to me. So what we're finding is that we have a disconnect in the message and also the messenger. The disconnect is that it's not about us. And if you have the right person or the right organization that knows how to reach African Americans, we wouldn't have so many people that weren't reached. Now those people are going to be punished because they weren't reached. And all of the other on the ground where folks came in and spoke with them, that's a different way of reaching people, and fine. But whenever you go and you use other media or you use media in other communities, our media is not a part of that. Now, it needs to be a coordinated effort. It needs to be the chambers of commerce. It needs to be more of the NAACP. It needs to be all of these people together. But it needs to be coordinated, and that's what an African American company can do. I am so sorry, but when I looked at who Identity Media was, it's a global firm. Why do we have a global company coming to California to tell us how to reach the African American population? I've said this before. I continue to say it. And as my husband says, maybe I should stop saying it and just write it every week in one of these black newspapers that were not used in a proper way. Thank you.
Thank you, Ms. Brown. I appreciate your comments.
Thank you. So to go back to the proposed restructuring, if I could, of the advisory committees. And again, I will note that we will follow up and continue to work on these issues. So we have a proposal to restructure the Marketing and Outreach Committee that we have an outline of that we shared with our Marketing and Outreach Committee, which would have a overall committee with then subgroups specific to the Latino community, the Asian community, the API community. And there's questions exactly what is the right composition, what's the structure, how to hold meetings that are both population specific as well as cross-cutting. Having a cross-cutting strategy needs to be anchored in the needs of cultural issues, communication issues specific to each community, and that's one of the things we want to build for. So, and this is, again, we're soliciting comments on how to potentially do this restructuring. Are there any questions from the board on that? Okay. I want to turn now to, since the board last met, we have announced the individual rates, and I want to run through that very briefly. The board and the public has seen this publicly, but it's something that I think we should all feel proud of. We have 10 plans that will be offering individual coverage next year. They reflect, in most areas of high population, anywhere from 5 to 6 plans to choose from for consumers. And they reflect both the largest plans in the individual market, but also plans that are signature plans in their local communities, plans like Western Health Advantage and Sharp and Valley Health. Also plans that have a history of serving Medi-Cal, like LA Care and Valley Health. Plans like Chinese Community Health Plan that are anchored in their community. The overall weighted average increase is 4.2%. We say again and again that averages are interesting, but in the end, what matters is what happens to an individual. And a couple of the changes when we take this down to an individual level is about 16% would actually see their premiums decrease or be about 1%. 13% would see a increase of less than 5%, 35% of less than 5%. About a third increase of 5 to 8%, and 13% over 8%. But that's a change in premium. And one of the things that we'll be spending a lot of time as we move into open enrollment is discussing not just the premium change, but what the change is for the 88% of consumers that actually get subsidies. And we have available on our website a book that goes through every region because it's region specific, it's age specific, it's premium assistance specific, and that information actually lays out, and I'm not going to run through all these in great detail, but I'll note that, for instance, in the Central Valley, where premiums may have gone up 5%, because of the change of premium assistance, an individual who is 25 years old at a silver level will actually see their premiums go down by $1. What their experience is by going down $1. If they're a 40-year-old, their premium experience with the tax credit could go down $2. Now, in LA, that subsidy-eligible person may spend $7 more, $9 more. But all of this is to say that as we move into open enrollment, we, and I say we meaning the certified enrollment counselors, the agents, our service center people, have work to do to explain the difference between premium and what people's actual experience is in terms of having changes of what they're spending. I will note that of 18 of the 19 rating regions, subsidies will either stay the same or actually increase. In one region, Region 10, the subsidies will actually decrease, but in that region, the overall premiums increased only by 1.9%. And again, this is a factor of how the second lowest silver interacts with the premium of other plans being offered. I want to do a brief update on SHOP. I'd note that we will be announcing the SHOP plans that we will be selecting in mid-September, September 15th, and their rates at the beginning of November to allow for both renewal and new sales going into the 2015 plan year. And we're looking forward to that. The other thing I will note before moving to benefit design is we did a press release yesterday announcing our dental plans. And as you all know, but I think it's important to remind us all that we did not change benefit designs generally in 2014, with one major exception. All of the individual offerings now include embedded dental for children, embedded pediatric dental. So every child that is enrolled through Covered California will have dental coverage. And we announced yesterday the dental plans that are matched to the health plans on the embedded side, but also that we will be offering family dental plans where individual adults can buy up for supplemental dental, or children that want to have a separate dental coverage from the one they get as embedded can buy that offering. We think this is a broad range of options for consumers. We think it's affordable and important to provide this for children throughout the state. I would note that the availability of the family dental options will not be out of the gate on November 15th, but will be in early 2015. This is some of the IT systems we have. And we will be doing additional marketing and outreach to provide for the availability in January, and we can do that enrollment for individuals that may have missed that opportunity in November. And we are being very clear in our renewal notices for children that have dental benefits to have them understand how when they select a health plan, they are now getting dental benefits and to understand what that means for continuity with dental providers. With that, I am thrilled to introduce Ann Price. This is the first chance that the board or the public has had to meet Ann. Ann is our new Director of Health Plan Management to provide a quick overview of our plans for benefit redesign as we look forward to the coming years. Ann.
And welcome, Ann. And I don't think we pointed out at the beginning, as we did, I think, the last month, we broke up the executive director's report with regard to public comment. So we're going to take a break after this item for public comment on the QHPs and the updates that Peter has provided before we go to the next part of the executive director, so you can plan your comments. Welcome, Ann. Thank you.
And you need to press the button that turned, there you go, thank you.
So good afternoon, Secretary Dooley and Board. As Peter stated, this is my first meeting, so let's go ahead and dig into it. So as you know, we just finished the recertification process of our plans for the 2015 calendar year. So a key piece of work for us now is looking into potential benefit redesign options for 2016 and for following years. It should be understood that this review is not just a one-year approach, but rather a multi-year strategy for the continued improvement of our standard benefits. Guiding principles that we will look to develop for your consideration include the continued philosophy of standardized benefits, and we will consider benefit changes that relate to a consumer's experience of access and cost. To do this review appropriately, we need to have data to make informed data-driven decisions. An example of how we would rely on data to inform our design changes is in the bronze product, where in addition to preventive services with no cost, we offer 3 visits with a flat copay that do not apply to the deductible. And the intended goal of this design is to limit the cost barrier so members can receive that initial medical care and develop a relationship with their medical provider without concern of high cost. Without having the claims data to review, we really have no insight as to if that 3-visit design is achieving what we set out to accomplish. So data is key. And of course, the guiding principle is to ultimately have a benefit design that is easy to understand and allows consumers to obtain their care at the right place, right cost, and right time. Slide 23. So where are we and how will we start on this work? The next few slides will serve as a high-level view of the considerations and timelines staff is working towards in developing a proposal that will be shared for board discussion, approval, and culminate with the inclusion of any changes in the certification and recertification requests that we send to plans in February of 2015. First, we'll start with looking at the redesign changes that were discussed among consumer advocates and contracted health plans in 2015. We will allow time for further stakeholder feedback, and again, understanding that data is limited, we will be looking at incremental design improvements as part of a multi-year progressive strategy. So this slide 3, it really should be 24 if you're looking closely. This slide depicts our landscape that Covered California is working within when considering benefit redesign. And the landscape in the orange, it represents both statutory, which could be federal or state requirements that we must follow, and then optional changes that we are considering. The gray area is supposed to represent the years that are really already set. Obviously, in 2014 was our first year, and that's really our baseline, if you will. In 2015, we did consider benefit changes, but in the end, we determined that we would stick with our 2014 benefit designs so we could promote consistency and stability. But now focusing on 2016, we know that the actuarial value for the metal plans will change, And initial thinkings from our actuaries is that this could be worth 1 to 2%. And again, that this is a progressive strategy and we're looking multi-year. Another key change will be in 2017, where the 2 of the affectionately known 3 Rs will be expiring, and that's the reinsurance and rate corridors. And that funding was really set up to protect the plans in the first few years of this offering. Slide 4 is just a high-level timeline, and of course work is starting now, but will really start beginning in September. There's time built into this timeline for stakeholder feedback. We are looking to bring a proposal to the board for discussion in December, and that December timeframe will allow us to understand the change to the actuarial value calculation and include that in our proposal. And then looking forward then at the end in February again, then that's when we send out the information to the plans for recertification, and they'll need to include that information when they submit their rates for 2016. Are there any questions?
Questions from the board? No. Nicely done, Ann. Thank you
You're being very
much.
kind. Thank you.
Thank you. We don't want
Just
to
wait.
scare you away at the first meeting. Oh, wait.
Whoa, sorry, you
Now
got to
you've
step
got
back up,
Kim.
Ann.
No, I was just going to say, wait till next month.
Oh. Thank you.
And one, I want to tell you, it's been a real pleasure having Ann on board, and I want to note that to underscore a couple things in this is that it's not a one-shot and done issue on benefit design. We will be constantly relooking at benefit design based on the evidence, based on having data. We do think that we will not have much data from which to make decisions for 2016. We still want to look very closely at issues around coinsurance, deductibles, and cost sharing for specific services, but it's a building process as we go through for future years. So we look forward to this timeline to have continuity and clarity for consumers as we go ahead with issues of clarifying what benefit designs are going forward. With that, I think we would pause for public comment on the issues we've covered before moving on to the next topic, except for Mr. Fear.
Yes. I don't know if this is
Get
appropriate.
a little
but
closer to the mic.
Before we move on, I've just been reflecting on the feedback we got from the African American Caucus, and I, just building on what Susan said, feel it really is important for the board to make, I think, an express request of staff going forward. And I just want to say what I think makes sense and what I don't think makes sense. I don't think there's a lot of value in looking backwards, and doing some in-depth post-mortem, what went wrong, who's responsible, etc. I think it's clear just from the feedback we've heard that there were shortcomings, period, many of which were described, and that there's substantial room for improvement going forward. That's clear. And that we would benefit from some sort of plan or strategy that's developed over time to do better than we've done in the past. And this is probably not the only example. We know there are other communities where we need to do better as well. But I just think it's important somehow that the board acknowledge in some formal way that we've heard the feedback and that we'd like to see improvement.
Thanks, Paul. Got it. Anthony, start us off.
I'm looking, there we are. Anthony Wright, Executive Director of Health Access California, although I want to speak as
Are you standing in for Beth today?
I'm not. I'm specifically saying that I am speaking in that hat so that
I see her. All right,
Health Access could have its time as well, but I wanted to speak as the newly nominated chair of the Marketing Outreach and Enrollment Committee, Advisory Committee.
And thank you for that service, by the way.
And apparently we have a job to do. And one of the things that I want to say is we appreciate the proposal to have a fresh start of that committee. There have been other advisory committees. I think there's been a lot of positive feedback about how the Plan Management Committee has been running. But there, on the marketing side and with some of the subgroups, there have been some issues about that. That they have not been timed or planned as well to really get as much useful input for the staff as I think the staff or the participants want. That there is, that with so much to report, there hasn't been enough time to get the input of the members. I think that that's been felt both at some of the subgroups as well. And frankly, having the subgroups for different populations sort of I think it's appropriate to have those communities be part of the broader marketing outreach education committee, so that it's an integrated and comprehensive discussion, while also having specific focus and time and attention to really dive deep in what it needs to what we need to do to be successful in the Latino community, African American community, etc. But frankly, it needs to be part of the overall, because outreach to those communities is central to the success of the entire endeavor. So we appreciate that. We appreciate the extra time to do that. We had a short conversation at the Monday meeting, which was my first attempt at sharing, and we did go long, and so we didn't have tons of time. So to have an extra week to take comments on that, I've gotten some general positive feedback on that, but I think the extra time would be helpful to check to see if that's a right way. One last thing is that one of the proposals is to potentially have a conversation about whether we should limit people who are grantees. I think that would be a mistake. We have QHPs on the committee. We should have agents. Community groups should also have a say there. I think the conflict of interest is important for the board, but for the committee, you want the people who are in the trenches doing the work. Thank you.
Thanks very much, Anthony. Thoughtful comments. I appreciate it.
Good afternoon. I'm Somalan McGalker with the National Health Program. I wanted to focus my comments on the inconsistency policy, and I know this has been just shared with the public, and we haven't even, as advocates, gotten to talk to staff as we would love to do. I guess I'm concerned in making sure that we have an overall messaging strategy on this, because there is still backlash around immigrants getting health care inappropriately, and I just want to make sure we clarify that anyone who attests to immigration status, having eligible immigration status, or being a citizen, there's consequences if they falsely attest beyond getting coverage. So it's very rare that immigrants falsely attest to that, and I want to make it clear that the inconsistencies is that we're doing follow-up, but the verification and self-attestation, is honest. Like, the consumers we're not weeding out fraud necessarily, but just making sure and doing follow-up to make sure that consumers have their verification. We'd love to know what percent of the applicants that you're looking at are income inconsistency issues, what percent are citizenship, what percent are immigrant documents. Those are very different things. We also want to make sure there's a reasonable opportunity to cure, and I know there's going to be issues about, after the 30 days, if someone provides their document, how to re-enroll. When income is found to be less than what Covered California limits are, we would love to find out if Covered California can make sure that their individuals transferred to Medi-Cal, because they are either Medi-Cal eligible or Covered California eligible based on income. And then I know this is a federal issue, but just to make sure California raises it, is to hold harmless individuals who received tax credits and maybe their income could not be verified and they lose coverage, that we find a way to hold them harmless for the tax credits that they have received. All these issues raised for me I guess the clock never started, sorry. Okay, the last issue I'll say is that all these issues I just want to flag for staff and the board is we have ID proofing coming on, and we're going to have inconsistency issues with ID proofing as well, and that we clearly have a process in place to immediately resolve ID proofing issues, because you cannot start the application without passing ID proofing. So thank you.
Thank you very much.
Carrie Sanders with the California Pan-Ethnic Health Network. Just quickly, I mainly want to talk about the inconsistencies, but just as one of the groups that have raised the lower than projected enrollment in particular communities of color, including the African American community, just happy to hear that you'll be taking the concerns of the Black Caucus seriously, and hopefully integrating some of that into the marketing and outreach work group, advisory group, which I think has some renewed energy now with a new chair. So excited to have been participated in the first meeting and heard what was talked about. With regards to the inconsistencies, we really appreciate the multi-touch approach that you're talking about. We are concerned, though, that the notices are only going out, at least my understanding today, is in English and Spanish. We feel it's important because these are notices of potential termination of coverage, that consumers, that the rights of consumers be considered. That includes the right to translated notices in the Medi-Cal managed care thresholds and also the thresholds of the QHPs, the qualified health plans. So would appreciate some clarification on, what that process will look like, what the translations will look like. Would love to participate in actually, looking at the notices. We realize that this is a truncated process, that you have to act very quickly, but we just really want to make sure that people's rights are not violated through this process. The CMS notice also, I just would note, contains taglines in the English version, which I forwarded to staff in non-English languages, and so at a minimum on the English notice, we would hope that you would include those taglines. I also forwarded, consumer groups in other states have actually created a notice to CECs that they can use, sort of a template to explain to their enrollees, hey, this is happening, you might be getting a notice from Covered California, contact us, we can help you through this process, and hope that you'll consider promoting things like that. Thanks.
This turns off automatically all the time, but in our new configuration, can you see when the clock runs out? Because I'm having trouble knowing. I don't want to cut people off, but is it clear to you when the time is up?
Yes, I would. It's very clear. But what's missing is the beep.
So, all right. Yeah, I'm getting a little bit of noise over here.
We'll turn up the beep volume for next month.
Yeah, thanks.
Good afternoon. Edwin Lombard with the California Black Media. First off, I'd like to ditto everything that the Black Caucus said earlier. As an outreach specialist, it is very clear that in the African American community, people feel that they were not informed properly or given the proper information for them to enroll in this very important phase of healthcare. Secondly, as far as the restructuring of the advisory committees, I think what you're trying to do is perfect, and it should be done that way. But I think those subcommittees are important also, because there are very specific issues that are important to the respective communities that need to be discussed in those subcommittees and then brought up to the broader committee. And hopefully those issues in the black community won't get lost in the process. And then finally, what I'd like to do is suggest that you hire a consultant that understands media as far as the black community is concerned, someone with a proven track record that understands the credible sources that will actually get the information down to the root base of the black community in order to help these people to get involved in this Covered California. The other thing is, I think you should engage the Black Chambers of Commerce, the local organizations of the NAACP, the Urban League, and some of the faith-based organizations throughout the state that have their fingers on the pulse and can get to these people and get them enrolled. I think these are very important things that need to be done. And Paul, thank you for recognizing those comments made by the Black Caucus earlier. Thank you.
Thank you very much.
Good afternoon. Betsy Emholtz from Consumers Union. I wanted to echo those thoughts as well, and I really appreciate the board's redoubling its efforts on the African American community outreach. We participate as a public member on the Marketing and Outreach Committee, and will continue to do that, and look forward to greater success with African American community. The restructuring is great, I think, on the Marketing Committee, because we are having, if you get to a place that's very much like the Plan Management Advisory Committee meetings, which I've been a part of, it's been a very effective and energetic process, and a really good dialogue between staff and members. One evidence of that is the roadmap that was created. That was a prioritization. It's a multi-page, gigantic document with all the issues that any stakeholder wanted to put out there for consideration. The challenge with that big list is that it is a big list, and got a chance to meet Anne for the first time last Friday at that meeting, and look forward to working with her. Evidence is important always, but in this area, just want to make sure that we talk together about setting the priorities. Some things we already know, which is that consumers are very confused by coinsurance with good reason. There's no way to understand it. The standardization of benefits really works well. Confusing deductibles doesn't. So I hope as we set the priorities, I know we can't do everything on that big list at once, but that we'll really focus on those issues and allow enough time. I think it's more than one meeting a month needed because conceptually things are difficult, actuarial analysis is difficult, and then the plans, of course, need time to create new products. For 2016, they need to start early, so we're really respectful of that as well. So we look forward to working on that together. On the discrepancies issue as well, it's really unfortunate timing because of the renewal process starting, open enrollment happening, and I know you are operating under dictates from the federal government. With all the multiple notices going at the same time, we look forward to working with you on the notice content. So to bring us in the loop. Carrie and CPEN folks and others are better on obviously on the translation issues, but we'll look forward to working with you on clear notices. Thank you.
Thank you, Betsy.
Madam Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty and the Health Consumer Alliance. We appreciate that the board is taking the CalHERS contract option for the vertical integration with the other health plans to have a no wrong door experience. And we understand that the decision not to do the CalHERS contract option on the horizontal integration is really a fiscal one. So we appreciate the statement of intent that moving forward people can use their health application information to apply for CalWorks and CalFresh. And given the underutilization of the CalFresh program, which is 100% federally funded benefit that is just critical to help people be healthy and stave off their hunger. Western Center is the first to say that the basic health care functionality needs to be in CalHERS. We know there are many priorities, and we're putting pressure on you on the Medi-Cal side as well as the Covered California side. But we look forward to getting to a place where it really is a portal for many different programs. On resolving inconsistencies, we understand that certain verifications are required, but we concur with NHELP's concerns about how that is messaged. And in particular, I think it's fair to say many of the notices that have gone out to consumers from Covered California haven't been a model of clarity, and we really would welcome the opportunity to engage. I know time's limited, but you often give us short turnarounds, and we need to make sure those notices are messaged correctly. We also appreciate the focus of the board about responding to the need of the importance of improved outreach to the African American community, so thank you. And then on benefit redesign, we were disappointed that we couldn't make more changes for 2015, but understand that decision, but really concur with Consumers Union, as we've been saying all along, that we want to move away from those co-insurances and want to make sure that that is part of the engagement and discussion for the 2016 benefits. Thank you.
Thanks, Elizabeth.
Nice to be in your home here.
Thank you. Yes, it is nice.
Good afternoon. My name is Betzabel Estudillo with the California Immigrant Policy Center, and I would like to address two things, one of them being the inconsistency notices and the restructuring of the committees. To begin with the inconsistency notices, as you know, the immigrant communities are very diverse. They're not all Latino. We have very diverse communities, and so we hope that these notices go out more than just Spanish and English, that they're in API languages, and that they also address, I think I heard that there's like a multiple touch approach, and so we're really happy to see that. We understand that immigrant communities are still fearful of deportation, so when they do see these kind of notices, there's still a trigger of deportation processes, especially for their undocumented family members. So we hope that you continue to use some of the folks on the ground that can be able to address some of these concerns that they have. Now, the other thing on the restructuring of the committees, I'm actually a member of the Latino Advisory Committee, and I think with the restructuring of the committees, there's a real opportunity to really address some of the concerns that have been raised as of the structuring of these advisory committees. For example, with the Latino committee, there was a lot of issues with timing. Many times we didn't know when the meeting was going to take place. We were giving maybe a week or a week and a half notice, and so for many of us that are not located in Sacramento or that may have a pending issue, it was really hard to figure out how to come to the meeting. A lot of the agenda items were sent out the morning of the meeting, and so it was really difficult for us to really look at the issues and provide constructive criticism or provide some feedback. And so we hope that when you are restructuring these committees, that there is a real opportunity to include some of the issues that have been flagged before. And thank you.
Thank you very much.
Good afternoon, Carolina Coleman with Insure the Uninsured Project. I have a note about the standardized benefit design. We feel that it's really been crafted very, very well in many ways. I can tell you from my personal experience trying to help family members in other states, California looks amazing and easy to understand. But there's one area that I think needs some improvement. The specific exemptions from deductibles in bronze plans and in silver plans are frankly, they're perfectly thought out, but nobody knows about them. I've trained close to 1,000 CECs and worked with other stakeholders in the last couple months, and very few people have ever heard that you can go get services with a silver plan and not be subject to your deductible at that point. So there's really very, very little knowledge about this amongst CECs and amongst consumers. So I would really stress that you make those exemptions very, very clear in the CEC trainings going forward and any products made available to consumers. Thank you.
Great. Thanks, Carolina.
Good afternoon, Board of Members. Autumn Ogden with California Coverage and Health Initiatives. And we wanted to echo our gratitude on the CalHERS contract option as that of Ms. Landsberg earlier. Our members and partners see firsthand on the ground how important it is to integrate these services, and we applaud and thank you for your commitment to move forward to ensure that we have a truly integrated system, and we look forward to continuing to work with you on this. Thank you.
Great. Thank you.
Good afternoon, Carlos Laporta with the Green Lining Institute. First, I wanted to just acknowledge and thank you for staffing up at the service centers and noting that 70% of those new hires are bilingual. It would be good, though, for us to know what languages those staff members speak and that they're reflective of the demographics of those who are eligible and enrolling in coverage through Covered California. So just some data that would be nice to hear. In regards to the eligibility inconsistencies and notices, we support the comments of Ms. Sanders and others that we need to make sure that those notices go out in clear language that are and also in the top 13 threshold languages as well. And then last, in response to the comments from Assembly Members Bradford and Brown, we support the comments that were made and would encourage the board and the staff to take them very seriously. We would also add that on numerous occasions, and most recently in the latest budget, there's been funding allocated to hiring a cultural and linguistic coordinator. We would actually really encourage that position be a director level position for diversity and cultural competency so that individual could work closely with staff, consultants, and the marketing division to ensure that everything that is being produced at Covered California is really relevant in the community and reaching the community where they're at. Thank you.
Thanks, Carla.
Hi, good afternoon. Dorina Wong, Asian Americans Advancing Justice, Los Angeles. And yes, well, Carla, you actually identified several of the issues around the hiring of the bilingual staff and knowing, what languages they specifically will cover. And also, I think in terms of hiring or having a cultural and linguistic department or even a director will help alleviate some of the issues around the outreach and education for certain racial and ethnic minorities, because I think people sometimes think cultural outreach, cultural competency is more specifically around language, but it is not. Of course, it deals with race as well, and so a lot of the cultural issues are related to health literacy and the idea about reaching out to, let's say, African Americans or Latinos or the Asians. We have that in common, and I think the opportunity, and if we are part of the marketing and advisory board, we will be able to share our promising practices, and we can share how we have done outreach in the different specific communities, what's worked, what hasn't worked, and actually I think that is a really positive step. So the other area that I wanted to also reiterate and support the comments by NHELP and Western Center and Carrie around the inconsistencies and making sure that those notices are translated. I mean, it's very key. And if you do use if you can't, and you at a minimum need to use taglines, and if you do use those taglines in the federal, I think in the federal letter, the taglines, it's not identified as an important or vital document, and we should make sure that consumers know that they should really pay attention to this particular document, because otherwise they will not even bother calling if it's just a tagline. And then finally, the issue around the training for certified health educators and certified enrollment counselors is key, because they're the ones who are going to be giving the assistance and explaining how to resolve these inconsistencies. So we need to make sure that they're trained well. And actually, if there are materials that you're going to be sharing with those counselors, we should have those materials translated as well. So thank you.
Thanks, Dorina. I'm beginning to figure out how I know when the 2 minutes are up, because these microphones kind of turn off automatically. So when I don't have a microphone, I know you're out of time.
Hi, Brett Johnson with the California Medical Association. And I guess what I'm speaking to would be considered benefit redesign. So in your benefit redesign principles, you talk about transparency to enable informed consumer choice, you talk about data availability. And right now there's, many consumers and physicians who are having issues understanding the networks via the directories and also the formularies. I know there's some legislation happening on formularies, so I won't talk about that too much. But in terms of directories, this is the second meeting now where I believe for this meeting we have 140 slides of presentation material total, and some of the issues with directories and networks aren't mentioned once. I know there was a letter to Representative Huffman that was included in the materials, and I thought a lot of that information was helpful, and I think it would have been great to include it in the agenda, as its own agenda item. But the consumers out there are really having a lot of struggles figuring out who's in the networks, who's not in the networks, how they get access. And I think it's something that definitely deserves the board's attention. And with 2 more board meetings before open enrollment, I think this is something we should probably start talking about a little more in terms of how to solve it, and how to make sure that consumers out there really understand what they're getting with some of these products. So with that, thank you.
Great. Thanks very much.
Hello, Sonia Vasquez with Community Health Councils. As a member of the Marketing Outreach and Enrollment Advisory Committee, quite a mouthful, and the Latino Advisory Committee, I welcome this restructuring of the committee. I think that it provides an opportunity to really dive deep into some of these issues that were brought up by the Black Caucus and really come up with strategies that will hopefully reach larger percentages across all different ethnic groups. I do think there's value in having separate conversations for each ethnic group, but you can structure the meetings in such a way that you have breakout sessions, you have general sessions where we can all come together and really dive deep into these issues. And it's important to remember, especially in urban settings, many of us live side by side with other ethnic groups, and so when you have you can have one strategy and one spokesperson that speaks to one group that will probably also speak to another group as well. And so being able to hash those things out together, I think, will be great. And just a note on the inconsistencies issues. As has already been said, it'll be important to really train our certified enrollment counselors and certified educators to know how to help people. And I don't know where we are in terms of the recertification process, but I think this has to be a part of that recertification. Thank you.
Thanks, Sonia.
Hugo Morales, Executive Director of Radio Bilingüe. I have a few comments about the challenges that remain in terms of outreach. I think we've come a long ways. But, in terms of Latino audiences that call into Radio Bilingüe, there seems to be a sticker shock when it comes to, for example, the amount of premiums, co-pays, or things that are not covered. It's something I think that goes to the fact that most or many of the people that have signed up already have never had health insurance or experience, don't know the system. So there needs to be, a lot more education along those. And also, folks report having a hard time to finding doctors, specialists, and also those that are in Medi-Cal trying to wait for their enrollment to take effect. Those are some of the challenges that they face. We've been part of the outreach, and we look forward to continuing acknowledging that it is a formidable challenge. In terms of the advisory committees, I think on its face, I would support something like that, but I would want to remind folks that the media is segmented, and it's so. I've been part of the Latino Advisory Committee, and we've had the benefit of having Peter. Thank you, Peter, for attending all the meetings, and the senior staff, and we're able to go deep into matters that pertain to the Latino population. And so I hope that those meetings continue. Definitely there's room for coordination, but I think that, and have an overall plan, but I think that we need to benefit from that because media is segmented and there are particular needs of each of the populations, including, of course, the African American community. So in terms of the how would I say, this notices that are going out for confirming citizenship, I hope that Covered California will be sensitive to what a challenge that is for immigrants. Myself, I recently applied for Medicare, didn't realize I had misplaced my naturalization certificate. I applied in March. I'm still waiting for it from Homeland Security for a copy. So, it's quite a challenge. Also, in Mexico, probably about a third of the population right now is trying to get their birth certificates. And for myself, I had to go through that, last year. I was surprised that my birth certificate had the wrong name. So that's a huge challenge. So anyway, I just hope that you'll be sensitive to these challenges that immigrants face. Thank you.
Thanks, Hugo. And I want to say, too, that I was particularly pleased in the field poll this week about how much improvement in public attitudes there are in Fresno. So thank you very much for your work with Radio Bilingüe.
Hi, everyone. Rebecca De La Rosa with the Latino Coalition for a Healthy California. And just wanted to comment, we work in very close partnership with the California Black Health Network. And so I just wanted to urge the board to really take serious the concerns that were brought to you by the Black Caucus.
Great.
Thank you.
Thank you. Thanks for your service.
Kevin Canal, certified insurance agent in the Sacramento area. Just two items, one on marketing and communication. First, HealthNet is eliminating all of their PPO plans and coming out with a new plan, an EPO. They even stated it's a new plan in their filings with the California Department of Insurance. There's no mention of that in our handbook for all of the plans. With an EPO, there is no out-of-network benefits. I already have one client that has met his deductible with HealthNet on out-of-network and is going into co-insurance. So if he stays with HealthNet, his prices, his premiums will increase not only because of the 6 or 7%, but he won't have the co-insurance. So we need to tell consumers that if they're in a HealthNet PPO plan, that's a new plan. The EPOs are new and the benefits are different, and there will be cost increase. The second item on the communication, since late June, Anthem Blue Cross has said that they have had real problems getting the data feeds from Covered California for new enrollments. I enrolled 2 people in early July. As of yesterday, Anthem Blue Cross doesn't have any enrollment data for them. These people are paying out of pocket for their doctor visits, their prescriptions, and their lab tests. We enrolled them before the deadline. Now, I don't know which IT, goofed up. No one really cares. We would just like to be told, hey, this is an issue that's going on. It's happening. But you talk to Covered California, it's an Anthem Blue Cross problem. Talk to Anthem Blue Cross, it's a Covered California problem. Just communicate with us, folks. Just tell us there's an issue, we're trying to resolve it. It would really make the PR go a lot further with people that are trying to enroll. And we told them, hey, you'll be all set up August 1st. Nope, August 21st, still no health insurance. Thank you.
Thanks, Kevin.
Good afternoon. Cynthia Kennedy. I'm the statewide projects and outreach manager for the California Black Health Network. And I'm also just following up with Assembly Members Bradford and Brown in their concerns. And what I think you heard was really a lot of frustration. I know that we had a special meeting with Yolanda Richardson and Garrison Rios in Los Angeles in April, I believe it was, of this year, on this same matters. And they actually acknowledged that, no, it hadn't been done the best way. And yes, there was the need for improvements, but thus far we've seen and heard absolutely nothing. So basically, I know there's a lot of frustration around media and marketing for not only the African American community, but also the Latino community, because I have spoken with some of our Latino partners in Los Angeles who are basically telling me the same thing. We basically are echoing each other. And one other thing I wanted to say as far as media and marketing, this special enrollment period, I have not heard I've not seen any commercials, I haven't heard anything on the radios, and I don't know if you realize what a huge opportunity it is during special enrollment. I am getting more and more consumers that call me because their friend or someone told them I work with Cover California, and they tried to enroll, but they were given the wrong information. Now, sometimes this was through an insurance broker, or it could have been even through the call center at Cover California. And so I'm letting them know, well, you know what, you qualify for special enrollment. But I'm saying there was a large number of people that we could have really enrolled during this period had they known, and thus back to media. So,
Great.
Thank you.
Thanks for your thoughtful comments, Cynthia, and thanks for all your support.
Beth Capel for Health Access California. Thank you for including us, the chair of the Marketing Committee, as well as Health Access. We appreciate it. I want to echo the comments of my colleagues with respect to resolving inconsistencies and also with outreach to various market segments. I know that you're going to have further discussion on that later in the agenda. I want to focus particularly on the plan management issues, including the provider directories and network adequacy, a subject that comes up every month at the Plan Management Committee that we attend as a public member, and would encourage others to participate as well. With respect to the benefit designs, as you are looking forward at these, we have repeatedly noted the importance of revisiting the cost-sharing reduction products and the annual out-of-pocket limits for those and the cost-sharing design for those. These are for our lowest income Californians who are below 250% of poverty. Your current benefit design can expose an individual to a cost that is literally 2 months' income for a single night in the hospital, thus rendering them homeless, which we don't believe is your intent. We would also encourage you to look at the recently released data by the Department of Managed Healthcare about enrollment in your standard benefit designs. We are very pleased to see that 1.4 million Californians are enrolled in standard benefit designs, and only 185,000 are enrolled in alternative benefit designs, 125,000 of those in bronze non-HSA products. I think we ought to look seriously at that now diminishing sliver of the market and the implications for benefit design for your share of the market. Thank you very much.
Thank you, Beth. Anything further from the board before we go to the next item? Kim.
Yeah, I just want to underscore the observation or the point made by Autumn and Elizabeth regarding the board decision made in closed session on the CalHERS contract related to horizontal and vertical integration. And just to underscore what Peter said from the board's perspective, there's no backing away from our commitment to moving forward with horizontal integration, but as was noted, we just felt there's a more cost-effective way of doing so. So appreciate that opportunity to underscore the board, commission, our ongoing commitment.
Great. Thanks, Kim. Peter.
Yeah, two things. I'm not going to, is one, many of the comments rightly focused on the issues around the concerns raised by the African American Caucus, and I think that we do take the concerns very seriously. We think we have a lot to learn across the board in all the markets we reach out to. I will be presenting on some of the approaches later in the board meeting, but this is an ongoing process that we'll be looking at very, very closely. The other issue, many of the comments spoke to the issues of inconsistencies, and we appreciate the whole range of stakeholders being ready and willing to roll up their sleeves and work with us on communications, notice, through many, many channels. This is confusing. We know, in particular on immigration status issues, some consumers are quite concerned about that. It's a sensitive issue. We want to get the notices right. We very much appreciate the willingness to roll up your sleeves with us in very short order as we get out to keep every Californian that has insured. And this is, we are quite confident that where people have not provided information, it's not because they are not citizens or don't have legal immigration status. It's because of challenges with getting material across to us, et cetera. And we have a legal obligation to get that, and we'll work with you and work with our enrolled Californians to get that information to us so we can keep them with their insurance status. With that, would turn to the next item on the agenda, which is the Insurance Rate Public Justification and Accountability Act. So this is a couple things that I would remind the board and the public about is staff was directed by the board and consistent with our responsibility both for planning purposes and to inform the public about implications of major changes, actions that could affect us. We've been conducting research on the implications of Proposition 45, the Insurance Rate Public Justification and Accountability Act. And what we're doing today is providing an update to the board and the public on where we stand with the work that's been going over the last 3 months. And I appreciate both the meetings we've held with the whole range of individuals and the active engagement on this issue. It's an important issue. We have a lot of moving parts before Covered California, and this may be a new major moving part that we need to understand and thoughtfully consider. Part of the context for this on our process is that at June's board meeting, which was the last board meeting we had, we presented a list of questions and analysis we were looking at. We have since then were called upon to testify at a joint hearing on July 2nd. We've held meetings with the Department of Managed Health Care, with the Insurance Commissioner, the Department of Insurance, with consumer advocates, with health plans, with a whole range of organizations. In looking at the research we've done, we've reviewed the testimony of the Commissioner, responses that he has provided both in meeting with us as well as in writing, as well as the testimony provided by a whole range of individuals at the joint hearing. And we received, in follow-up to our solicitation request for comments from 6 different organizations that we provided to the board. And that, along with our legal and staff review, has gone into our current analysis of where we stand and where we believe Prop 45 may impact us. I want to remind us all very briefly about what the Prop 45 is, which is it would subject all health filings to approval under a Prop 103 framework that are health filings in the individual and small group market. So I need to bracket, this is not all health filings, so it does not consider Medi-Cal, it doesn't consider Medicare, it doesn't consider large group, but if you're in the individual or small group, it provides for prior approval by the Commissioner under the same Prop 103 structure. And it applies to all rates that were in effect as of November 2012, with the transition as we're going forward. There would be a review by 2 regulators, and not of rates for approval, which would all be with the Department of Insurance, but currently the law provides for the Department of Managed Health Care not just to have regulatory oversight of the healthcare service plans, which for Covered California reflect 9 out of 10 of our plans and reflect, I believe, anywhere between 80 to 90% of the individuals insured in the individual market. But currently under law, the Department of Managed Health Care also does rate review, which does not include approval, but it's a rate review in addition to the broad range of oversight of issues such as network adequacy, a whole range of other factors. The initiative provides a broad definition of what rates are, including all things that may affect rates, co-payments, co-insurance, and any other elements. And the initiative provides for a role for interveners that is structured broadly by Prop 103, but with provisions for the insurance commissioner to implement new regulations that might change or adapt the processes under 103. A major element of the 103 structure and by the Act is that any rate changes of over 7% have a required process for hearings if an intervener wants to have a hearing, which then sets in due process requirements. So that's just the background of the broad context. So we're not advancing. There we are. So I want to note a couple things on our analysis overall, and then I'm going to go through 5 specific areas that we've identified early on, and we've had getting, in many cases, a clearer picture, and in other cases, a picture that remains unclear because of uncertainties that will only be clarified after the initiative passes, if it passes, and how it is implemented. But before going to the 5 specifics, I want to underscore that our review of Prop 45 is a review of this Act as drafted on our operations, with the consolidation of rate regulation in one of 2 regulators, an intervener process, and building on the Prop 103 process. We have not done a review of how a rate regulation proposal in another structure would impact our goals and processes. We've looked at Prop 45 as structured, building on 103. And based on that review, and looking at the plain reading of the Act, its broad definition of rates, the rights of interveners as currently structured, we have significant concerns that there could be detrimental impacts to Covered California's operations. The scope of those impacts, we cannot be certain of. They could be either mitigated or made worse by how the Act is interpreted and implemented by an elected commissioner and potentially by the courts. When 103 was passed, it was subject to litigation of how it would be interpreted, and the interpretation of the Act is subject to the commissioner that would implement that Act, and there are significant uncertainties on how that would play out. But because of the plain language, we think there could be significant detrimental impacts to Covered California. I'm now going to run through the 5 areas that we've queued up to consider specifically with regard to the potential impacts on Covered California. First is Covered California is, unlike most exchanges around the nation, an active purchaser. Much of what we've heard discussions about today of how do we structure benefits, the benefits of having standardized benefits, the creating a marketplace that looks not just at cost, but at what are the right networks, what are health plans, engagements on quality initiatives, on prevention, is central to Covered California's commitment to addressing the triple aim, an aim that seeks to not just lower costs, but to improve quality and improve health of the Californians that have coverage through Covered California. The plain language of the Act provides a very broad definition of rates. That rate regulation could include anything that affects the charges associated with health insurance, which could include networks, broad quality improvement, other factors that could be considered subject to the Department's regulations and potentially judicial interpretation. In looking at that, we are concerned that Covered California's role as an active purchaser could be significantly undermined. If health plans coming before Covered California think that there is only one marker factor, which is needing to hit a rate and not look at quality, not look at preventive care, not look at improving the delivery system, this is would be a detriment, we think, to California's consumers and to our mission. The extent to which this would play out is an uncertainty that would be determined by, in many ways, how the Department of Insurance would approve rates and how they would interpret the Act if it were to pass. The second area of concern relates to the timeline. Open enrollment happens once a year. It's a 3-month open enrollment this year. It may be a shorter open enrollment period next year. We follow the federal open enrollment periods. And the timelines for decisions on the rates are set and would be set by CDI. And we would need to look at and understand the implications of that timeline and how that interrelates with the Department of Managed Health Care's ongoing obligations to be a regulator of health plans. Again, 9 out of 10 of which the Covered California plans are regulated by the Department of Managed Health Care. If there were some reason that a new rate were not approved in time for open enrollment, plans would default to the old rate. Now, regulations to determine the review and the hearing process would need to be established. This is the domain, rightly, of the Department of Insurance. And the current timelines of Prop 103 would provide significant disruption. The extent to which CDI would, as they've noted, provide timelines that would meet our needs or meet whatever was needed by having earlier deadlines haven't been elaborated to describe how that would meet the due process requirements, the Administrative Procedure Act, and it's something that leaves us with a significant uncertainty of what would the timelines be and how they would impact our operations. Second, and independent from the issues of the Department of Insurance's timeline, is the extent to which Department of Managed Healthcare would need, subsequent to a CDI process, re-review, or could they have complementary timing reviews of their processes. To the extent DMHC, which has an absolute obligation as the regulator to look at issues of network adequacy, to look at benefit designs, has changes because of a rate regulation that would have a plan change what it did, it would need to relook at things. That could implicate our timing. We aren't sure how much, but it causes us concern. Third area of potential concern is the risk of withdrawal of plans. This could be either in advance and just a plan deciding not to participate in the individual market, or subsequent to the rate regulation process. Now, we believe the risk of withdrawal is uncertain. CDI has stated an intent to only order rates that would be both not excessive and also adequate, which should mean that carriers would not face dramatic losses based on regulated rate reductions. That said, how plans respond to rate regulation is uncertain. The extent to which a mandatory intervener hearing process is unresolved could lead to a default rate, which would place a plan at risk of going forward with a prior year's rate. To the extent the department ordered a new rate that was considered too low by that plan, the plan would need to evaluate its potential losses and how they would mitigate those, either by potentially not participating in a particular region or statewide. And that's in the context of medical loss ratio rules, in which plans would have very limited ability to, quote unquote, make up losses in subsequent years because of the overall structures around the 20% of costs which can be used not directly for care. Fourth area is effect on plans in 2015. Now, as I noted, the Act itself provides for a look back through to 2012. However, that look back is specifically would mean that where the department were determined that rates were too high, looking backward, the effect of that is to provide rebates to the consumers in the plans in which rates are found too high. And plans could be required to pay those rebates to affected consumers. For rate changes for this year, 2015, which we're in the midst of, we understand that the rates would be deemed approved because the rates for 2015 would have been filed 60 days prior to the action of the Act. Now, those rates could still be subject to rebate if there was an action. But for our purposes, for consumers being able to shop and buy with the knowledge they could have those rates, they would be able to be on the shelf and not subject to change, but again, subject to the look-back issue for consideration of potential rebate. Finally, we have looked at the issue of the potential impact on federal subsidies. And this is one of these issues which gets very technical and very confusing very quickly. As you know, about 90% of Covered California's consumers have federal subsidies. From their perspective, what they pay to a health plan is a combination of the federal subsidy and the premium assistance, those two factors together. The amount of the tax credit is a factor of the second lowest silver in each region. Now, the impact of rate regulation in lowering or raising a rate of a particular plan. Because again, rate regulation is about rates being adequate and not excessive. So an order could be that rates are too low or too high. Could mean that the second lowest silver plan changes. In changing it, if you are in that plan, whatever that rate order would be would have a direct effect on you by that amount. However, changes affect other people in the market. It could actually lower or raise the cost of other consumers in the market by changing the amount of the tax subsidy available in that region. Now, these impacts are possible, and they could be disrupted relative to timing. We want to be very clear that these are impacts that are happening today. We saw across the 19 regions in a number of places. I noted that in 18 of the 19 regions, on average, the premium assistance went up or stayed the same. That's average. For a number of individuals, their experience of their rates will be affected by the change of the second lowest silver. And so, in kind, while this could happen, I want to be clear this is the same sort of effect that could happen in kind through just the natural process of rates where some plans come in much lower and much higher than they were in the prior year, and it changes the relative position. So, this is a complex set of issues. We've spent a lot of time looking at this. We believe there are potential significant effects on Covered California. In the end, the scope, shape, and nature of those impacts are now uncertain and will be uncertain until and unless the initiative passes. Because the actual shape and nature of their impacts is going to be the subject of actual regulation to be put in place by the elected commissioner and potentially by by judicial action if the courts are weighing in on how to interpret the act, which could take some time and is quite possible. But all in all, we do not have a question that there could be significant detrimental impacts on our operations. And we think this is an important thing that we have done planning for and considered. I will note that given all the planning we've done, all the review and processes, at this point in our review, we aren't clear what other questions could be answered until we get to the point of actually having an act that is passed and regulations in place, because other things are actually dealing with the uncertainties. What is clear is the plain language of the act. What is clear is how Prop 103 has been acted on. And what is clear is that we have in California a new marketplace with a whole set of new rules that do protect consumers, that do provide rules for insurance companies to accept all comers, that do have new rate protections that are in play and are new. The Prop 45 would be a new factor we would need to work with and consider that if it passed, we would work with and make it work as well as possible, but again, potentially to the detriment of our current operations and programs. With that, I'd turn to the board for questions, and then we would take public comment.
Susan.
Just start with a comment. I believe that under the best case scenario, enactment of this measure as drafted would significantly complicate Covered California's ability to implement federal health care reform. Even under a best case scenario, it adds delay, confusion, litigation, risk of retroactive rejection, and cost to the process of negotiating benefits. Covered California is in the process of implementing probably the most complicated health care reform initiative in the last century, maybe even the most complicated health care reform in U.S. history. Impeding our ability, doing anything that makes this harder to negotiate benefits and plans that are based upon quality, access to specialists, access to hospitals and doctors in regions that give people choice, that give people value, and that give people an affordable, accessible health care is going to end up hurting Californians, hurting consumers, increasing costs, and it will damage health care reform perhaps permanently, perhaps fatally in California, and I think perhaps even nationally. Even if you believe that rate regulation is the right thing to do, now is not the time to make the job we're in the middle of any harder. I think it's a very, very important. I think it's very important that we state clearly that we think that there are problems with enacting an initiative like this at this point in time, and that we are unequivocal in articulating our concerns. If it passes, we're going to carry it out. We're going to make it do. We're going to do our job and make it work somehow. But anybody who cares about health care reform, and everybody in this room has spent the last year spending a lot of our professional lives trying to make something historic happen and happen right. I just think it's the wrong time to be adding an entire layer of complication and risk to what we're attempting to achieve.
Anybody else? Kim.
I'm eager to hear further some of the comments I know we'll be receiving. I generally agree with what Susan just articulated. I want to acknowledge the work that Peter and his staff have done in terms of the research and the questions that were identified and shared, the comments or the conversations, multiple conversations, the written comments. I think Peter's absolutely right in terms of we won't know until we know the full range of the impacts. But I think Peter is informed by the research and the learning to date. Notwithstanding those unknowns, there are, as you just articulated, some very clear knowns that I think are extraordinarily problematic for the operations of Covered California and the consumers we serve. And for those who are interested in where Covered California is on Prop 45, I think it's a fair question and one that we should answer. At a minimum, acknowledging the findings of the staff research to date, and acknowledging the very significant, if not grave, concerns that Prop 45 could be detrimental to the operations of Covered California and the consumers we serve. So eager to hear more from public testimony, but I think Susan's put on the table a very important question in terms of what we say as a commission regarding this initiative and its implications given what we know to date.
Thanks. Anything? Okay, let's take our public comment and then we'll circle back. This is a discussion item on the agenda. It is not an action item. So if you want to start us off with the public comment.
My name is Gail Nickerson, and I'm here to represent the California Association of Rural Health Clinics. And we are opposed to Proposition 45 because we do share concerns that it will impede Covered California's ability to operate. I'm sure that you know that rural health clinics can be a key access point for those newly insured people through Covered California who live in underserved, non-urbanized areas. And any disruptions to Covered California plans would be harmful to the patients that our member clinics are caring for and the clinics that California Association of Rural Health Clinics represents. And we think that Proposition 45 does have the potential to delay health insurance plan approval and that it could limit the plan choices for the low-income families that use our clinics. So we want to encourage you to think about the possibility of actually opposing it the same way that we do. And we're very grateful for what Covered California is doing. I know that it's going to make a big difference in the long run. When we look back, we'll all be very grateful for everything that you've done. Thank you.
Thanks for your comments, Gail. Hi, Gil.
Hi. Gil Ojeda, UC Berkeley, California Program on Access to Care. 2 months ago, I pointed out a few things, and I'm going to actually re-point them out because it seems to be the concerns that are being registered from the front seem to be fairly close to what they were before. 6 or 7 years ago, there was this movie called As Good as It Gets, and universally, one of the clap lines, the very large audience clap lines, was this negative comment about insurers. And virtually in every theater where that program, where that movie's shown, everybody clapped because the insurers are the bad guys. Now that sometimes real, sometimes not real. We did see in the poll, a very excellent poll, if you will, that was released yesterday by the field poll. It said that Democrats, Republicans, and Independents supported Prop 45. Now, it seems to me, and the indication I made last time, is that we need to be talking about how do we implement a law like this or a ballot like this. There's two issues, 2 points that the director made about this plain reading, if you will, and the issue of uncertainty. Okay, well, the plain reading even points out some issues related to, well, we could go back to 2012, but the reason that the wording is like that is because the proposition was supposed to be on the ballot in 2012, and I believe the director, CDI director, has already said that that was not his intent. And there's a partnership, if you will, and I talked about that partnership at the last meeting, between the Department of Insurance and the Department and Covered California that ought to be engaged with, and I know is being engaged with. I think there's things that need to be and should be negotiated, if you will. Okay, even the DMHC issues are negotiated and actually can be worked well on both sides. So I think let's stop with the accusations and let's start with the work and collaboration.
Thank you, Gil.
Hello, I'm Joseph Zamudo Dio. I am past president and now a board member emeritus of the Osteopathic Physicians and Surgeons. I practice family medicine in Fremont, California. I wanted to let you know that Covered California is doing a good job expanding access to much needed health care. Many of my patients are currently still with me because they're insured under Covered California. I have new patients coming in who've been delaying their health care for a number of years and now are getting the much needed health care. As with any major overhaul to the healthcare system, there are a few growing pains, some of which I've experienced. The problem being lists of specialists who didn't know they were on the list and not willing to accept patients. So clearly there needs to be better communication and concerted effort to get the specialists to sign aboard. We've heard the concerns that Covered California Board has expressed about Prop 45 and how it could reduce access to specialty and other providers because it would force heavy emphasis on rates at the exclusion that the plans would have adequate network coverage. Prop 45 is outdated and doesn't reflect today's reality. We urge you all to formally oppose Prop 45. Thank you very much.
Thank you, Joseph.
Howdy, folks. Michael Weinberg with the Bay Area Council. The story of our work together on the implementation of the Affordable Care Act has been the fight against sound bites. Whether it was death panels or government
come on,
takeover.
Micah, you are the prince of sound bites.
I know. I'm working on it. I got a couple of good ones coming up.
Oh, good.
I got a couple of good ones coming up.
We'll give you an extra 7 seconds.
Thanks. But our rebuttal is often more complicated, and so as an advocate for the ACA, I have to think about how do I take this really complicated thing and turn it into a soundbite. So the same is true with Prop 45. The soundbite is the insurance commissioner will lower your rates. The reality, of course, is more complicated. Had the insurance commissioner been your boss last year, and this proposition makes him your boss, we'd be talking about rate spikes. He wanted to extend non-ACA compliant policies indefinitely, or as long as the president said you could. Those states that did that are having rate increases of up to 15%, in some cases more. Here we're sitting pretty at 4%. This is a testament to you and your system and your work. Congratulations. Injecting additional layer of regulation into this system will sabotage it. Most critically, the timelines just don't work. Unless I'm living in a totally different world, we didn't have a ton of extra time. We were just sitting on our hands over the course of the past year. We needed absolutely every second to get things worked out. And the passage of this proposition will clearly lead to lengthy court battles, as it has under Prop 103. The commissioner's staff has tried heroically to cover this pig in lipstick, but it's a pig. And, even Gil's like, well, I know that this, whole 2012 thing is totally ridiculous, but we'll just ignore that. No, it's totally ridiculous. This initiative is a pig, and we need to speak out clearly about that. So thank you so much for having done that today. Thank you, Susan. Thank you, Kim. Thank you, Peter, for your report, for your work at the informational hearing, your comments in the newspapers. We need to keep doing that in every place to the extent of your power and to the extent of your authority to educate the public, because this matters to California families. I'm a covered California consumer with my family, and we actually, in spite of the fact that we're unsubsidized, have the same premium this year as we did last year, plus we're getting pediatric dental, which we opted out of last year. It's too important for the families of California to mess with this system. Congratulations for the work that you've done. Let's stay the course. Thank you.
Thanks, Micah.
I don't know if I have quite the same sound bites as Micah does. Hi, I'm Julie Broyles, here on behalf of the California Association of Health Underwriters, and we are a group of licensed certified agents here in California that we believe we're very good partners with Covered California during the recent open enrollment process. What we do, we are counselors and we are advocates for our clients, and during the sale, before the sale, and after the sale. And what our clients tell us what they want is they want stable, affordable health care that gives them real choice and coverage that will be there when they need it. And we look at Prop 45 as something that takes a lot of that away. We do think that with the Prop 45, it's highly likely that we would have a number of negative impact on our clients. We think that the industry, if this goes through, would undergo a lot of changes, and we believe that there would be fewer plans available to consumers if this is enacted in November. Any delays in the process of getting plans approved for client use, for consumer use, is a problem. And if you have interveners that can come in at the last minute and stop your plan from going into play, it puts the whole enrollment process into question. And I think it's, again, the fact that you're taking some very deep breaths and looking at this and asking the important questions now and what it would do to your implementation are very important. We do think that for small business, they face a lot more problems if this goes into place, because the commissioner would have the ability to come in, change their rates, change what their deductibles are for their employees, and possibly make it unaffordable for them at literally or no notice. But we think that we do continue to need to focus on four things. One, the initiative is retroactive. The plain reading makes it absolutely clear it goes back to 2012. What does that do to the taxes, the subsidies, the premiums, any of the charges that have been made and paid out and that would have to come back and be recalculated, medical loss ratios? Will there have to be recalculation of those subsidies? What is the impact of the startup funding that you had? Do you have to go back and redistribute some of that back at the federal level? Last of all, what is the impact on the plans in terms of fees charged by the exchange or plan members or policyholders, and the ultimate impact on the consumer? For all of these are deep concerns about Prop 45, and we're glad that you're taking them so seriously. We do think this could be fatal to health reform in California.
Thank you.
Good afternoon, David Chase with Small Business Majority. We've looked at the proposition and basically agree with a lot of the staff's findings. I thought Peter did a great job of analyzing some of the potential implications, so I won't rehash all of those. We generally agree, but we do think it makes sense for Covered California to let the consumers know that you represent. Here's our findings. Here's how we think this could implicate our job in helping you, the consumers of California. So we would consider you or ask you to consider being out there and letting the consumers know, here's how we think this impacts us and in the end impacts you all. Thank you.
Thanks, David.
Madam Chair, members, good afternoon. Julian Canetti, California Asian Pacific Chamber. We want to also express our concern and opposition to Proposition 45 and many of those concerns that Director Lee pointed out as well. You know, our organization has worked hard along with others throughout the state in working and aggressively working to educate, to enroll Californians and small businesses throughout the state. And we're concerned that this proposition will seriously harm the availability of plans for consumers and for our small business owners and impact the Covered California program in a negative way. We urge you to oppose Prop 45. Thank you.
Thanks very much.
Good afternoon. Bill Barcelona with Cap Chief Physician Group, serving 18 million Californians.
Thanks to the director for that legal analysis on the impacts of time to market. That was what I was going to talk about today. And I'm still reeling from Mr. Weinberg's graphic description of the proliferation of pork products in the ballot. But so let me narrow my comments to a very esoteric issue. Our physician groups in California focus on capitated payment, alternative methods of payment other than fee-for-service. The problem with this impact and this uncertainty in the time to market for these new products and new benefit designs is that when you move to alternative benefit designs that shift risk, financial risk and clinical risk from the plan to the provider, you need time to assess the actuarial analysis of the products that are going to be presented. This time window that we have between June and November to get these products approved and to market really will inhibit the ability of us to move to these alternative payment models that involve risk sharing among providers because of the uncertainty. And I'll give you an example from the implementation of Prop 103 in the auto insurance market. In the history of the implementation of 103 with respect to auto carriers, what we've seen is that they will come in with a proposal to increase rates by 2%. It will go at the Department of Insurance for 6 months or more, and they will often receive a decision from the department decreasing their rates, sometimes by as much as 7%. If physician groups were involved in an alternative payment contract with a plan for Covered California, and we were doing a percentage of premium capitation arrangement on those grounds, you couldn't go forward in a viable risk-based contract. I know my time's up. Thanks.
Thanks, Bill. Appreciate your comments.
Hi, Brett Johnson with the California Medical Association, with physician members that are also within the member groups of CAPG that Mr. Barcelona just represented. I'd like to echo his comments and just state we are opposed for many of the reasons that were stated by Covered California, and that just generally, without going into it too much, a lot of the complications would flow downstream to physicians who are trying to finalize contracts and everything prior to open enrollment, and it could cause some real issues for consumers to understand what the networks are before they actually purchase products. So thank you.
Great, thanks. Janice, we have a call, and there's another one. Do you want to do the cleanup? Do you want to stay back and be last, or whatever? Let's take the call and then the other witness, and then we'll go to you, Janice. Operator, we have a caller. Would you please have them identify themselves?
The caller is Emily Lamb from the Silicon Leadership Group. Please go ahead.
Yes, good afternoon. My name is Emily Lamb, and I'm the Vice President of Healthcare and Federal Issues for the Silicon Valley Leadership Group. And we represent 400 employers in the Silicon Valley area who are large purchasers of insurance plans. And we have the same concerns articulated by many today and agree with the comments that Susan Kennedy and Kim Belche have stated. And while the companies I represent really want rates to remain as low as possible, we do not believe that Prop 45 would achieve this. And in fact, we believe that it might actually hurt purchasers and consumers. And so we very much echo many of the concerns folks today have said.
Thanks for your call, Emily. I really appreciate the work that you do down there. So thanks for calling in. Go ahead, Janice.
Janice Rocco, Deputy Commissioner at the California Department of Insurance. At this point, you have about 20 pages of written material from Commissioner Jones about the ballot initiative. He's answered the first set of questions from the June board meeting, as well as the subsequent questions that followed the meeting that we had with your staff. He's also testified at the July 2nd hearing in the Capitol that you can all view. We have now heard for the last few months a lot of public statements being made about concerns that Covered California has, misplaced or otherwise, about Proposition 45. You have put forward your questions and your concerns and now your analysis. So, the public has all of that. And at this point, I would say that There are 35 other states that have rate regulation, along with either a state or a federal exchange, and they managed to make that work. You have raised operational issues, and we can certainly work with you in the coming months to address all of those. And as we saw yesterday with the poll that shows that 69% of voters currently support the initiative, it does seem like some time would be well spent having Covered California and the Department of Insurance and others work on implementation issues so that if it passes, we're ready to go in November. Certainly our department will be doing that. And so I think the only other thing I would say is to address what Micah said earlier. It is difficult to understand how he feels that 20% or 40% or 80% or 100% rate increases that some folks in California experienced in 2014 as they moved to the new products, with now smaller rate increases that build on those up to 80% and sometimes even higher rate increases from 2014, is a better situation than what he described as 15% rate increases in other states.
Hey, Janice, just 1 second, if you could, with a question. It
Sure.
has been represented to me that none of the other states that have rate regulation have an intervention process. Is that true? Or is there any place where they have interveners that are like the 103 process in another state?
I'm not sure if it's exactly the same as 103, but there are states where there are consumer organizations that intervene and provide testimony at public hearings and get reimbursed for their costs. And so I don't know how to differentiate it, but there certainly are states that have that part of the process.
Do you know whether they have the judicial, the ability to go to court as an intervener? I can look it up, too. It's just been represented. I thought you might know off the top of your head. Great. Thanks, Janice. Do we have another call? Was that the old caller? Okay, thanks.
Kevin Canal, certified insurance agent. For some reason, I've been reading through the rate filings from the Department of Managed Healthcare, and it's really interesting stuff. Why did Kaiser lower their rates this year? Sometimes 4% in some regions. Were they too high last year? Are we going to go back and hit them? Is that what Prop 45 is going to do? And then there are other areas and other plans like Anthem Blue Cross. There are 15, 17% increases in some areas. I don't know if that's excessive or not. I think kind of the carriers have kind of brought on the rate regulation bandwagon, and that's why so many people are at this point favoring it. But if those folks would have lived through the last 12 months of getting Covered California up and running and all the challenges you folks still face, no, we don't need another layer at this point in time. Let's just fix what we have before we add something else onto it. The bureaucracy is just going to be incredible, and I don't think the consumers are going to be able to live through another year with all of the different things that Prop 45 might bring wrong. So thank you so much.
Thanks for your comments. Peter, I have a question for you or for Kathy, Keishan, our general counsel. Several of the witnesses have asked us and others have asked for a formal position, and I've put my old lawyer hat on and tried to read the cases and understand what public agencies can do in a ballot measure. It seems very clear to me that no resource can be used for any campaign, and I don't think anyone has suggested that. But the question of actually taking a position or stating what our concerns are from an analyst standpoint, because we've been specifically asked, and it couldn't happen today anyway. We were noticed as a discussion item. I'm assuming if there was an action item, it would have to be noticed at a properly noticed meeting. But can you help us understand what, to the extent we know what the law is about a position on a ballot measure?
And, Madam Chair, I think you're absolutely right. In terms of engaging in campaign activity, that's something that neither this board nor Covered California can engage in or enter into. There is guidance from the courts in terms of what kind of activities a public agency can engage in with respect to a pending ballot measure. We've done an analysis in our Office of Legal Affairs. We've also actually consulted with outside counsel because this is a very, can be a very complicated area of law, and there are some legal counsel that are experts in this area. And so we've had that additional assistance. We think that it is permissible for a public entity certainly to evaluate the merits of a pending ballot measure. and to express its opinion publicly as to the impacts of that ballot measure on its operations. We also believe that a public entity can take the step of taking a position on that particular ballot measure. There are some other activities, though, that we have to be very mindful of, which goes to your issue about campaigning. My time is up, I'm afraid.
Please continue, Kathy.
But in terms of how we express should the board take a position, how that opinion is expressed, those are the devil in the details, so that we would work very closely with the executive director and be very mindful about those details in terms of what our obligations are, both from a federal and a state perspective.
Thank you. I guess, Peter, before I ask for your comment, I'm deeply troubled by some of the possible impacts that are not related to regulation in the abstract. I think regulation as contemplated by the Affordable Care Act can fit very neatly with the operations of the ACA, and I do think there are some distinctions in California that make it more complicated. We do have two regulators, and this doesn't share the regulatory authority with both regulators. It does have intervention, and I think that's a distinction with other states, and I don't think there's another state that has embraced the active purchaser in the way we have and invested what we have in California in trying to change and get to the same objective on behalf of consumers of rationalizing an irrational system and controlling the rate increases, and we've had some success in these early months and 2 years of negotiating. So I share the concern of this infant investment that we have made and worry about interfering with that and this particular proposal and some of its provisions. With regard to the formalizing of a position, that is taking a vote and being on record for this, I'm also troubled by the intensity of the political campaign that will go on around this issue and the investment that we've also made in our integrity to be an evidence-based organization that is open and transparent and works on facts, and we've certainly done that over these last few months as we've looked at the impact of this particular ballot measure. And I guess I'm just a little bit troubled that if we take a formal vote on a bill on this measure, that we then get even more wrapped up in the campaign, and from the credibility that we're trying to establish with the body politic, however the voters decide, we are obligated to continue our commitment to make it work for Californians, and I feel very obligated to let Californians know. The Leader Pelosi asked my opinion. I wrote her a letter. I have not been shy about expressing my personal opinion about this. But I'm troubled a little bit by the notion that as an institution, we would take a position and then get wrapped up in all the paid media and in ways that the campaign we wouldn't be in control of, but that could be perceived as having campaigned for a measure, even when we're doing nothing to campaign. So that's where I'm kind of stuck. I don't have any ambivalence about my personal choice. I don't think this is a right law at the right time, and I feel very mother bearish about protecting the investment that we've made in the implementation of the Affordable Care Act. But I am a little bit concerned about whether we should formalize that in a vote that could be used in ways that would impair our relationship with the public. So that's kind of where I am.
Question. I'm not sure I'm not sure if there's that much added value to an official vote as long as board members are able to speak publicly and use their title. I mean, there's no, as far as I know, I want to double check that, but there's no prohibition on board members speaking publicly and being associated in their official capacity.
Sorry.
Yeah, you're back on.
Okay. That would be some of the detail that we'd have to work out with you, because I think when we take that extra step, particularly in the area of using federal funds, There are some restrictions there that we would really want to work out in detail before that added effort were one to be taken, or even if the board didn't take a position, what you could do publicly would be something we'd have to give you advice on.
Yeah, I do think that is an issue because I think that there have been situations where you use your title for identification only, and that has gotten it's a somewhat unsettled.
It's the whole idea of not taking advocacy, which is really prohibited.
Let me ask you a question. How many? It would require how many days' notice to publicly take a vote? 10 days, right?
Correct.
So if you can answer the question in short order, if we can't speak out and use our titles, I plan to push for a vote of the board for an official position.
Okay, and we could give you some advice in terms of the messaging and the upcoming board meetings. We'd be happy to work with you on that.
Peter?
Can I?
Yes, Kim.
Yeah, and I think the question Susan raises is an important one, but I don't know if it's, and maybe it's necessary for at least some commissioner and board members, but as a entire board, I'm not sure it's sufficient. I think we do have a responsibility to state formally, if not a formal position, at least express explicitly our concerns. And so, Diane, I appreciate your concern about perception and getting wrapped up in a campaign. We know that quotes made by at least one board member and Peter at our meeting in June have already been used in political campaigns. I'm observing that people are videoing this very meeting, which I'm sure will end up in a campaign. So we're a public body. And so I think we're already a part of that political football.
You notice Diana made me sit in front of the covered California logo.
That's not true.
Just saying.
Just saying. So I kind of feel like we're already in it. I think we're already in it. And I do think we have a responsibility to speak on behalf of the millions of people that we are touching, both directly and indirectly, and to speak clearly. If it's not, I would frankly be comfortable with us taking a formal position. But I also know from my experience on other boards, sometimes boards stop short of that and they express their significant concerns, their grave concerns, and we stick to the facts because you're absolutely right, Diana. We're an evidence-based organization. I think staff have done a terrific job articulating what we know that leads us to have, quote-unquote, significant concerns, but also acknowledging what we don't know. So I would ask that this be at least reserved as an action item at our next board meeting. And that's not to substitute, Susan, for your question about what individual board members can do in the context of our official position, our covered California positions. But I would like us to, as a full commission, consider what public statement we would formally make.
Before I go to Paul, do you want to say something?
Yeah, just a couple of comments. I mean, I share many of the concerns that have been expressed. I also share Susan's question as to if we were to take a formal vote as opposed to express our opinions, is there really particular added value or significance? I mean, there's a lot that's been stated already and or is in Peter's presentation that carries a lot of substance and I'm sure will be quoted in multiple locations. So although I also share Susan's concern to really understand what board members can or can't say and in what context, I think that's vitally important. And I'll just add on a personal note that however we manage this process, I'll just acknowledge one of my deeper concerns is we have one of the enormous strengths of the exchange to date is the way in which a very divergent group of stakeholders, all of you out there, have come together and worked together for common objectives to make this process successful. Last thing I want is this issue somehow to be divisive amongst us. That's, if I have sort of a visceral fear, that's it. And I'm just acknowledging it.
Yeah. Thanks, Paul. Peter.
A couple things, and what I want to build on Paul's note. I'm asked often, why has California done so well? Not that we've done things perfectly, but we've done pretty well. And a big reason is we as a state have managed, by and large, to put the politics behind this, and we've had people that may disagree with health reform saying, this is the law, let's make it work as well as we can. And I do not question but that Covered California will be part of the political discussion around Prop 45. I also don't have any question that people of good faith and can have different positions on Prop 45. Staff have attempted to articulate what we think are real and substantial concerns about how it could be implemented and affect us. I think that we are better served by not becoming, by our own actions, sort of a focus of the politics. Again, we have, across the political spectrum, across the range of organizations, we have been a safe place for people of different opinions to say, on this issue, expanding coverage, we're going to work together. And I worry of our taking a position would alienate some core partners, would have the totally inappropriate perspective and would be used inappropriately to say that we don't put what we do every day, which is put consumers first. And it's one of the things that, almost 3 years ago, this board established 6 values. The number one value is that we are consumer-centric, that we as an organization seek to do all our policies to be driven by what works for consumers. Now, we can't determine what either proponents or opponents of this initiative do. But by inserting ourselves actively and taking a position, I think would not do us well with the range of partners that have different positions on the bill, on the initiative, and I think would not serve the debate. We have sought to provide, through a dispassionate, reasoned set of analysis, what we think the concerns are. And that's what staff has attempted to do. I am worried about inserting ourselves actively into what will be a political process that we, in our 3 years that I've been here, have managed to have across the political spectrum, from Orange County to the East Bay, people of varying political perspectives, varying views say, let's get people insured. And that's so it is obviously at the board's charge. I think I appreciate our general counsel's view that it is taking a position is certainly within the spectrum of the board's authority. To my mind, we have a lot of work to do in California to get another 3 million people insured. We won't get them all in this next year. But the more that we become a focal of the politics, we're going to be distracting from our number one job, which is getting people enrolled. And I'm not saying that there aren't concerns about will this have potential significant impacts, and that's a trade-off that people need to balance. But the more that we can keep ourselves from our own actions out of the fray, I think we're better served.
I understand that. I share that worry, but I also, what you say about how hard we've worked to be a voice on behalf of consumers, I also think we have an obligation, because I do think this could hurt consumers and interfere with the outcome that we all want. I don't think there is a difference in outcome. It is a difference of design. So Kim has a request that this be put on the agenda as an action item for the September meeting.
Or at least for it to be noticed. And action can take a number of forms, as I said.
Well, let me just say, one of the, and that's, I want to be clear about what our next steps are, because boy, do I share Peter's concern about the amount of time that this is taking when we have so much other work to do to be ready to do open enrollment and all the other things. And I hoped beyond hope that we could have said what we needed to say, that the staff report is what it is, that we could be done with this, and the rest of the world will go on figuring out what they're going to do about Prop 45. Every month we keep it on our agenda. We keep spending time and energy. So I will just say, from a purely practical standpoint, we will have that before us if we put it on the agenda. But if that's your pleasure, we can.
Be clear that if I find out we can't speak freely with our titles, then we'll be noticing it on the agenda anyway. So,
Okay.
I mean, having a placeholder there is probably not a bad idea, even if we decide not to take a position on it. But
Well, I'm concerned about the public process that's going to determine. I mean, I think we're going to have to report back on this in September, one way or the other. We're going to have to report that what the legal finding is. I don't think the lawyer can just report to us separately. I think whether we have to or not, we should. We are a transparent organization, as we say all the time. So I think, Peter, we're going to have to put this to rest at the next meeting.
What I'd like to be able to do is work with general counsel. We can and do the legal research on what board members can say with what appellation relative to their board status. That notice that we would provide to board, even though it's legal, we would make public and share that publicly, and allow the board to defer to the board chair if that would address the concerns enough to say it would not need to be noticed for action. We could. If that would address the concerns enough, we would potentially not have it for action. The scheduling things for action needs to be determined 10 days before the board meeting. That would give us 10 days. Now, Kim, Susan had one set of issues which says if there was the ability for her to speak clearly, she would not have the need for action, which was not you speaking. So
Right, and I'm trying to draw a distinction. I think Susan's question is an important one. It's necessary, but it's insufficient. The question I'm putting forward is, do we, with all due respect to staff that's done a terrific job with the research and analysis, it reflects staff research and analysis, which is related but distinct from the board either taking a formal position or alternatively, as I've suggested a number of times, the board at least expressing, whether it be in a resolution or whatever, are significant concerns that Prop 45 could be detrimental to the operations that cover California and the consumers we serve, which is basically the board just affirming the findings from the staff analysis. But that's the board taking a proactive action, which is, in my mind, an appropriate and responsible step beyond receiving the research and analysis of the staff.
Are you putting that in the form of a motion? That this be an agenda item for September?
Yes.
Is there a second?
Second.
Kathy? Oh, we don't have to vote. That's right. We don't have an agenda item.
Right,
Thank you.
right.
We can't
Thank
vote
you.
on anything. So it'll be on the agenda. We'll figure out what we have to say, but we'll report back to you. We'll do this, in our normal course of process. So welcome to the, a public meeting. I'm doing it all right here. Okay, thank you. Are you wanting to say something, Beth?
Thank you. Beth Capel on behalf of Health Access California. We would echo, Madam Chair, your cautions and Mr. Farrer's cautions and your Executive Director's cautions as well. This is already an intense political discussion. Covered California has worked hard to be a trusted voice. You have had bipartisan support on occasion in the legislature, which is a good thing. There is growing commitment across California that this, even among the people who resisted bitterly health reform, that this is the law of the land and we need to make it work. To reinsert yourself into what is a highly polarized discussion, to insert this organization seems to us problematic. You had not had anywhere in the staff discussion or in the board discussion prior to public comment a discussion about action on this item, and so we had reserved our comments.
You can make them again next month.
But we do encourage you not to, we would actually encourage you not to notice this for action this month. I understand the board may do as it wishes, but we would strongly urge against that. Thank you.
Thanks, Beth. Okay, next item.
Okay, we will have a very brief report from David Panish on legislative updates that will probably take 13 seconds or so. Mr. Panish.
Very few things to report. We only have a couple more days of session. Tomorrow is the last day to amend bills. There are just a few that I want to highlight for you. AB 617 by Assemblyman Nazarian would codify the appeals process for our programs, including for Covered California. And we've been working with a number of stakeholders to get that together, and with the Department of Health Care Services and Department of Social Services as well. AB 1877, the California Vision Care Access Council. The proposal would create, and we've talked about this before, it creates a new Vision Council. It would be governed by the Covered California Board to create and manage a separate internet website that we would link to. That bill is now on the Senate floor. Let me skip to, it's on the next page. Whoop.
You're there.
Okay. SB 974 by Senator Anderson related to privacy and personal information. This is a bill that would have prohibited Covered California from sharing information about a consumer unless the applicant indicated that they did not want to be contacted. This bill was held in the Senate, but I just wanted to say that we are committed, as I had mentioned earlier, we were committed to implementing the policy behind the bill, and so that those implementation efforts are moving forward. And just one last bill I want to talk about is SB 1341 by Senator Mitchell, and that bill has been enrolled. So it's now to the governor. And that's the quick and dirty version. Thank you.
Thanks, David. Any questions? I think that might be the last item. Is there no comments from the board? Are there any public comments on David's report? Seeing none, that concludes the executive director's report, and we are about an hour and a half behind. So our executive director is doing a poll to see how long we're going to have a quorum, and I think when he gets the results of that, he may readjust the agenda. So I will turn it back to you.
We will have a quorum until 4:30 with one fewer member for 15 minutes of that time. Excuse me. There you go. We lost my mic. Sorry about that. They turn off. I'm still learning how to use this stuff. We will have a quorum for another hour, and we do have a number of action items we need to take up with huge apologies for our guests. I want to see, we were going to have Kaiser Family Foundation, Molly Ann Brody, present important information. I want to see if she can stay. Molly Ann, you okay? If we move the action items first, then come back to you? You are fabulous, as is your research and findings. I would actually ask us to switch to move the regulation actions first before either the update on the Kaiser Family report and on the updates on our open enrollment renewal activities. They are both rich discussions that I'd like us to get to as we can, but we need to do a number of action items. So I'd like to take us to the regulatory actions, and we have 4 of them before the board. So I'm going to ask us first to turn to Dan Fry. Is Dan here? Yes, he is. And this is on certified insurance agent regulation readoption. This is an action item. And can we jump us through to this? Thank you.
So which
is that on? There we go. Good afternoon, Madam Chair, members of the board, Mr. Peter Lee. With respect to agent regulations and the agent agreement, and for the purpose of incorporating policy and contract updates, we propose a number of changes. I'd like to note just a few, and as a reminder to the board, the agent regulations also include the agent contract. First, removal of the 4-hour recertification requirement for certified insurance agents. Although we propose this requirement be removed, we should note that licensed agents still have required continuing education credits that are mandatory through CDI. Most licensed agents have a 24-hour requirement every 2 years. Also, while our proposal is that there not be required credits or classes, it's important to know that agents have been continually requesting, and we are developing ongoing education subjects like Medi-Cal, the renewal journey. Both of those are already done. MAGI, household income, APTC, hopefully in the next few weeks. Online application start to finish, shop updates, shop renewals, and then in March, special enrollment periods. So the ongoing education material will be made available to distribution partners that we use, such as general agencies. Given broker demand for ACA-related training, we expect that material to be packaged by those organizations for CDI approval for formal continuing education credit. Lastly, for ongoing availability, these are developed as webinars. They're recorded, they're available as printable PDF, and they're housed on our website for future reference. They're shared with other distribution and service channels within covered California. I'd like to talk about just a few of the bullet items. Where are we going here?
You talk, I'll forward.
See where we're going here. Whoops. It's going by itself now.
There you go.
Beautiful. Okay. So the first bullet item, the term of the agent contract proposed to be changed from 1 year to 5 years. It's important to note that the health plan agent contracts off exchange are typically evergreen contracts. Amendments are made with sufficient notice to the agent if material changes are being made. So our change from 1 year to 5 years will help ease the administrative burden for all parties and be more in line with industry standards, reduce the concern of agents that are already concerned about their first upcoming renewal contract. The second bullet, our model here has been built on recognition of individual insurance agents. That's how the agent certifications are handled, and that's how the system was designed. Now it's necessary to extend that recognition to include insurance agencies from both a service standpoint and also with respect to our system and technology. That'll make it much easier for insurance agencies to do business with covered California. Fifth bullet, adding language that provides for agent compensation for Medi-Cal enrollments. The decision regarding this compensation was made after the initial or the original agent contract was finalized, so this update is needed. We're working with DHCS to operationalize those payments. And lastly, almost lastly, the seventh bullet, the current business associate agreement in the agent contract that's included as part of it is now rewritten as privacy and security requirements. And we've added a stipulation that non-licensed insurance support staff must be fingerprinted and background checked in accordance with state law. This would apply only to individuals that want to discuss consumer-specific issues with our service center or access our system. It's a significant service step for the organization. It'll help free up time for licensed certified agents to process more enrollments for covered California. Other issues that we're addressing, prohibiting agents from receiving gifts or compensation aside from their commissions for enrollment assistance, voter registration assistance, maintenance of records for up to 10 years now, and updating the marketing and branding guidelines. And just one last item, with respect to certified insurance agents, specifically regarding our policy for agent of record at time of renewal on the individual exchange. Well, we have confirmed that the current active agent will be maintained on our system. The agent of record does not drop off at renewal, whether or not a health plan change or a benefit change is processed, and regardless of whether that change may be made by the consumer or the agent. And that concludes my comments. I'd be glad to take any questions.
Thank you. And for the audience, we have 4 action items here, and they're sort of unrelated. If kind of give me a sense of, can we group them together and have comments? You want them one at a time? Okay, Betsy. Any questions from the board? Let's have public comment on this item.
Thank you.
And if you can, any of you use less than your 2 minutes,
Yes,
it will
ma'am.
help us. Thank you.
Beth Capel on behalf of Health Access California. We were unaware of these revisions to the agent agreement until this was posted at 8:30 last night. We are mindful of the important role that agents have played in assuring enrollment in Covered California. We are also very mindful that the current contracts expire on October 1st and that the board needs to take action today. However, we would like the opportunity to work with your staff to clarify and perhaps to do some revisions. For example, we were troubled at the elimination of continuing education given how much has changed in the health insurance market. As board members have noted, we think 5 years is very long for a contract in the public venue, and there are a number of other areas where we'd like to have the opportunity to work with your staff, but we are not opposing you adopting these today, but we would prefer in the future to have a little more opportunity.
Thanks, Beth.
Along the same lines,
Yes.
I was actually going to ask if we could not defer it until the next board meeting, but I know the timeline is very short. The two issues Beth mentioned are really the two key ones from my perspective as well. There is so much guidance changing all the time. We work with staff often on the training materials, and even getting that all straight for the certified enrollment assisters is difficult. Brokers have a whole different area of expertise, no Medi-Cal expertise. So the continuing ed is a big concern. Not having any specific requirements for continuing education for agents seems a problem. 5 years does seem a long time. We appreciate the important role that agents and brokers have played and continue to play, and we want them to continue to play. We also look at this from the consumer perspective and really want to make sure that we don't prolong if there are problems. 5 years does seem a long time. If the alternative is, if we must act today, again, working with staff would be the way to go, and perhaps there's some required training that could take the place of continuing education if we have to act on this today. Thank you.
And yeah, I'll save my questions. Thanks, Betsy.
Good afternoon. Steve Young, General Counsel of the Independent Insurance Agents Brokers California. Thank you for the opportunity to appear briefly. We support the changes that have been made. We'd like to thank the Covered California staff for the revisions to the agent agreement in particular. I will speak just to the one CE issue. There's no question that there needs to be, and we applaud the efforts of the staff to enhance the education and other materials that need to go to agents and brokers. That effort will be ongoing. It will be ongoing with our help regardless of this CE requirement. We think that's a common sense elimination in light of the other CE requirements that already independently exist to all licensees. I will say I am somewhat taken aback and given pause by the fact that Health Access has now made 2 pro-agent comments, and so did Consumers Union today, and I didn't think I would ever live long enough to hear that, but I am, I can now go to my grave a fulfilled man. Thank you.
We're all in this together.
Hi, my name is Dave Fear Jr. I am a certified enrollment agent, and I'm also the Vice President of Legislation for the California Association of Health Underwriters. And I wanted to get up here and publicly thank you guys for the work that was done on the agent contract. I know a lot of work was done working with us for the needed changes. In particular, we want to express our gratitude for Dan Frey and Daniel Eliab, who really did a lot, listened to our concerns, and then addressed them and are implementing those changes. We appreciate the removal of the duplicate training, as kind of was discussed. As a licensed agent in the state, we are required to have a certain amount of continuing education, and that would have been duplication on kind of what we're already doing, so we appreciate that. Especially appreciate the adding of the agent of record issue so that our staff can service our clients as well. And what you've done as far as the help that we've been giving to clients for Medicare enrollments, and that you're willing to show that appreciation by providing some type of compensation, and then also just that we can help. So I just, on behalf of the agents, wanted to thank the changes that, thank you for the changes that have been made to the agent agreements.
Thank you very much.
Elizabeth Landsberg with the Western Center on Law and Poverty and the Health Consumer Alliance, and we would briefly like to say that we do oppose eliminating the continuing education requirement. We appreciate that the correct decision was made early on that someone who starts an application has to go all the way through if the person is below 138% of the federal poverty level, and we appreciate that agents are asking for training on topics like MAGI and Medi-Cal renewals, but we do fear that it will be somewhat self-selecting as to who goes through those trainings, and we think that training is critical. So we would urge the board to reconsider that piece of the regulations moving forward. Thank you.
Thanks, Elizabeth.
Carrie Sanders with CPEN, and I really just want to echo the comments of Elizabeth and others with regards to the training. We are talking now about compensating agents to enroll in Medi-Cal, and so to make sure that they are also doing the training and keeping up with changes in rules and things like that is, I think, very important.
Thanks, Carrie.
Hi, Doreen Wong, Asian Americans Advancing Justice, Los Angeles. I want to also ask the board not to, or to delay or not to approve the removal of the requirements around the continuing education. As you know, a lot of people, a lot of community members in our community, in the Asian American and Pacific Islander community, use agents, but we have found that a lot of consumers have come to us because they've had problems working with the insurance agents, and we really think that they need a lot more training around what's basic elements of not only Covered California, but also for the Medi-Cal program. And so we would definitely want to keep that requirement in there because we're really worried that they're not giving the correct information to our community members. Thanks.
Thanks, Dorina.
Sonia Vasquez with Community Health Councils. I just want to reiterate what my colleagues have already said. Just to give you an example, I have been this year asked to present at an underwriters conference about Medi-Cal. They're reaching out again. I have a number of agents that constantly call me asking questions about Medi-Cal, which I know is not necessarily the purview of Covered California, but it is an important aspect of the enrollment application. So I would just ask that you really think about this and ensure that if whatever types of certification or training you want to give them, whether it's not as extensive as what they normally get, it should at least have a more extensive part in Medi-Cal, because I don't think that that's what they're getting at this moment.
Thanks. Any comments from the board? I would just say to the training issue, and Peter confirmed that we can make modifications or have another regulation specifically around the training or the issues that you've raised. I appreciate the recognition of the timing that we're under to keep this moving forward, but I'm particularly sympathetic to the concerns about training, and we will work with the staff on that. Is there other comment from the board, or I need a motion on this action? A second? Any further discussion? On the motion, Belcher?
Aye.
Fearer?
Aye.
Kennedy?
Aye.
The chair is aye. Thank you all. The next
next up we
item.
have, and I'd actually suggest if we can have Ms. Ravel present these three and then get comments on them as a block, if that's possible. And I think that they're, Ms. Ravel.
Good afternoon, Madam Chair, board members. The first one we want to do is remote identity proofing. This issue came before the board in November and was acted on. This is a slight refresh of the regulations to make sure that they align with the way the remote identity questions are actually posed in our online application. So they do a couple of things, which is required in federal guidance, and of course this requirement is to, as you're going through the flow of the application, to prove that you are who you say you are. So our regulations have several options. You can either prove your identity if you're working in person with someone by showing an identification document. You can sign a paper application, or in the online application you can answer a series of identity-based questions that we get through a federal service through Experian. And so this, the action today would adopt those regulations. And the final two are quick. We need to readopt our recertification, decertification applications. Those haven't changed. We need to keep those in force so that we can continue with our plan contracting process. And then also our shop appeals regulations, no changes to get them in force. Once you've adopted them today, we can take advantage of the trailer bill flexibility that we got at the end of June, so we won't have to keep coming back if we don't have changes. So those are my three. We have resolution numbers here. Are there any questions?
Nope. Nope.
Actually, just quickly, Katie, you used the term on the identity proofing. The verb you used was refresh.
Yes.
Refresh sounds benign. Are these non-substantive changes that
they are non-substantive? So you'll see in the text to say hit very directive for the consumer. So what you need to do is answer the questions and then hit continue, and the continue button is next to the button. So it makes it very clear where on the CalHERE screens, and that's detail that we didn't have when we brought it to the board in November. I would just add that we've really benefited from work with our advocate colleagues on this. They've helped the rollout very much, and we continue to work with them on this.
Thanks, Katie. Public comment on these proposed regs.
Carrie Sanders with CPEN. Just to say we understand that the remote identity proofing before you, the regs, are really just a readoption of the previously adopted regs. And we are comfortable with the language. We have been working with staff and really appreciate the responsiveness of staff to our concerns around implementation and the potential impacts for low-income immigrants and limited English proficient consumers. And we'll continue to look forward to continuing those conversations leading up to open enrollment so that we can hopefully avoid some of the pitfalls and barriers that folks face at the national level. Thanks.
Thanks, Carrie.
Ditto. There have been a lot of problems on the federal level with Experian, people being unbanked and not in the system, et cetera. But we've been working closely with staff on that, and we know it's required, so we'll continue to work on that. Thank you.
Great. Thanks a lot.
Good afternoon, Madam Chair and the board. My name is Sonal Lambic-Alker with the National Health Law Program. I want to echo Katie's thankfulness to the advocates, also recognize staffs very much working with advocates on the ID proofing issue. We appreciate the stakeholder input. We are still, because of the IT issues, I think there's still an issue that's unresolved about preserving the application date for someone who doesn't actually make it through ID proofing, and so I know we're working on that still, but I just want to flag it for the board. We also recommend that the call center establish sort of a troubleshooting group to work on ID proofing and have expertise in that area. And if there's any way to have an appeal process for those who can't get their ID proofing, or help them through the process for other ways, that would be great. Thank you very much.
You're welcome. Thanks. Hi.
Hi.
I've
missed you guys.
Yeah, I missed you too.
Linda Liu with Young Invincibles. This is not a good setup for tweeting selfies, FYI.
Oh.
So if you could consider moving the
I'll let
podium.
you work with the logistics staff. There are some other changes that we've made.
I do want
You and
to...
Anthony Wright. The other Twitter person I know.
Well, I learned from the best.
Yeah.
So I just also want to appreciate the work that your staff has done with advocates on the remote identity proofing issue, but wanted to ask if moving forward we could think about ways, maybe not like changing what we have, but also adding some other way to be more inclusive of folks who are maybe young and don't have a lot of credit history.
Okay.
Thanks.
Thanks for your comments. Any other comments? We have 3 sets here, right? We did.
Yes, we did.
Yeah. I'm losing track. So we need 3 motions. The first will be on the QHP and dental recertification and new entrant regulations readoption.
So moved.
The second? Second. On the motion, Belcher? Aye. Führer?
Aye.
Kennedy?
Aye.
The chair is aye. On shop appeals regulations readoption.
So moved. Come on, Paul.
Aye.
Second.
Oh, second. Sorry.
All right. On the motion.
Getting too late.
Belcher. Aye. Führer.
Aye.
Kennedy.
Aye.
The chair is aye.
Ready? Are
On
you ready? It's coming.
remote identity proofing regulations.
So moved.
Second.
Belche. Bearer.
Aye.
Kennedy.
Aye.
The chair is aye. Whew, we are getting punchy. All right.
A little bit.
Back to you, Peter.
Ms. Ravel, can you do a 5-minute on the two discussion items and basically just describe what they are? People can look at them.
Sure.
And we'll have, again, consideration at the next board meeting.
I can't read this, so I'll summarize. Eligibility and enrollment is not in print yet. You see some
For the
language.
record, you can't read it. Think how we feel.
I do.
We do have
She got me. The regulation, the amendments we'll do to the eligibility and enrollment regulations for action next month. Bring in some federal regulation language for renewals. What it's going to do is it's going to put in a hierarchy of if someone's particular product isn't available, what avenue can we give them to auto-renew? So, for instance, someone who's 29 years old but has turned 30, they're in a catastrophic product, they can't continue in that product, we can map them into the bronze product within their issuer. So there's a hierarchy of changes that we could make. And then I'm looking to TN. Oh, I know the other one. Our current regulations have us do a redetermination notice for all qualified individuals. That means people who have received an eligibility determination since October 1, 2013. What we want to do is send the individuals who got an eligibility determination but aren't currently enrolled a more simple notice that says open enrollment is coming and here's how you can come back to us. The folks who are currently enrolled with us would get the full notice that says, and here's your projected tax credit for next year. Those are the two major changes, and Tian's going to wave at me if I missed anything. And again, we're going to do, we'll do advocate feedback and plan feedback in the coming weeks. The next one is voter registration. So we were designated in May 2013, as you know, as a voter registration entity. We will be putting voter registration questions into the online application system and our paper application that will launch in October. So these regulations make clear what our enrollment assistance personnel need to do when they encounter those questions as they're helping someone through the application, and that is they need to ask them if they want to register to vote, and they need to offer assistance in doing that. So that's, and the text, the short text is in front of you, so that is the scope of that regulation. Questions?
And these will come.
These will come, both come
back
for
to
action
us
in September.
Yes. Any questions from the board? Any public comment on these discussion items? You'll get to see them, and hopefully we will be able to get it out. I see Dorino, but we will try. I mean, this timing problem of getting material out. We've been suffering under this for 3 years. It's just drinking from a fire hose. I mean, as you well know, and I do want to just say how much I appreciate that you respond as well as you do with short notice, but we are truly trying to get the material out sooner for your review, and certainly we will on these items as well. Yes, Dorina.
Yeah, hi. Dorina Wong, Advancing Justice LA. I wanted just to commend the board on implementing the voter registration and including it in the application, because it really is key, because it is especially important for some communities, especially the limited English-speaking communities, because if there's a link on there on the application, it's the opportunity to register in multiple languages is really important, and that will be automatically linked onto the application. And so I want to just thank the board for implementing that and making sure that it's going to be included in the applications for the second open enrollment period. And then also to just make sure that the training is there for the CEC so that, all the counselors will know how to actually implement it.
Thanks, Dorina. Kathy.
Hi, Board. Kathy Sunderling with the County Welfare Directors Association. Just quickly regarding the voter registration, our county eligibility workers are trained and are required, as you know, as similar entities to yours. I did just want to mention that I noticed in the draft regulations that there's a mention of your regulations covering individuals who are certified to do the work on behalf of Covered California. We'll just work with Tian and Katie to make sure that there's no overlap to the things that we've already agreed with the Secretary of State that we do on the county end, since I don't think you mean to incorporate us there, we already do that, of course, and we'll be continuing to do that on your behalf with individuals who come through our door. So nice to see you, and thanks.
Great. Yeah, welcome back. Thanks.
Good afternoon, Jen Floor with Western Center on Law and Poverty. Just a quick comment on some of the proposed changes to the enrollment and eligibility regs, which I think were posted this morning. One of the issues, we commend the intent for people who are losing access to catastrophic coverage to move them seamlessly into bronze if possible. We look forward to working with the staff so that the language is a little clearer on that. But one issue around, which we believe is coming from the proposed federal regulations, to what happens to people when there's not enough information to get them into, or to have them stay into a subsidized health plan, and it actually lands them into the plan off the exchange. We would like, to the extent there's any wiggle room in what ends up in the final federal regulations, we would like to make sure that we're protecting people's subsidies. And then as well, to the extent that the staff can communicate with CMS, as to, California's intent to try to make sure that people keep those subsidies and not just end up with the same plan but off exchange. Thank you.
Right. Thanks, Jen. Okay, Peter.
So let me note that that was the action items and queued up for discussion items. We will lose our quorum at 4:30. We will lose one of our board members in 37 seconds. But what I'd like to do is to move back to the Kaiser Family Foundation presentation of their survey and try to have a presentation in 10 minutes or so of what it deserves 2 hours, to then have the overview of our lessons learned and our plans with the incredible Cover California team doing that speed speaking to present in 15 minutes across all areas. It's going to be very fast, but I want to provide an opportunity for some additional consumer comment and reactions after both presentations. And we may have lost a quorum, but even if we've lost a quorum, we can continue on. And we would do that, but have as much of this as possible with the quorum present. So
yeah, I wanted to say, Peter, I'm willing to stay to the extent people can stay, and we can get this before the staff and the community of interest here. Since there's no action item, I do so appreciate your being with us and your patience in our schedule. So I do want to listen and be very attentive.
And I would now, just introducing Molly Ann Brody with a note of, she's the Senior Vice President for Executive Operations and Executive Director of the Public Opinion and Survey Research at Kaiser Family. Kaiser is one of our really core partners at Cover California. We talk a lot about being evidence-based. We do a lot of our marketing, outreach, design anchored in CalSIM, enrollment numbers, but also results of the longitudinal work that Kaiser Family is doing and our NORC research as well. But this has been important research that we thought that the board and the public should have clearly before them. So Molly Ann.
Thank you. Thank you so much for having me. I'm really pleased to share these results with you. I will speak very quickly. I will just say that you do have the full report in your materials and the chart pack and slides, and so anything that after the meeting, if anybody has any more questions, we could cover it then. This is a very unique project. It's the only one of its kind in the nation, I think. And it's a longitudinal panel design, and what that means is that we were able to talk to a random sample of 2,000 uninsured Californians right prior to open enrollment and ask them about their experiences and their plans and find out a lot about their lives. And then I'm sorry, that was right before open enrollment. Right after open enrollment, we went back to all the same 2,000 people and tried to find out what happened to them. And so this is one of the only projects where you can really track what's actually happening, not in a cross-sectional way, but in a longitudinal, individual way. It sheds light on what happened to the uninsured, on what worked well, what could be improved, and certainly some of the highlights and challenges that you're all facing, and we've been talking all about this afternoon in round two. So cutting right to the main finding, of the 2,000 uninsured Californians who we spoke to before open enrollment, 58% of them actually became insured over the course of open enrollment and over the course of the year. So 58% got insurance, 42% remained uninsured. I'm going to talk a lot about the remaining uninsured in a second because that's so relevant for round 2. But for right now, focus on the blue and orange sections of the pie. You can see a quarter of the uninsured got covered through Medi-Cal, 9% through Covered California, 12% through the employer-sponsored system. One of the things that I know we all heard a lot during open enrollment was lagging Hispanic enrollment. I think one of the things that's interesting is when we look at Latinos who are eligible for either Medicare or Medi-Cal or for Covered California, they actually enrolled at the same rate as white non-Hispanics. 6 in 10 of them became insured over that time frame. One of the other key things that I think everybody focused on, and it turns out it actually mattered a lot, was personal outreach, personal touch. I know all of you, everyone in this room, spent a lot of time on this issue. What we found is that people who told us that they had been personally contacted by somebody about signing up for insurance were much more likely to actually get insured. And in fact, when we did a predictive model and tried to use a lot of different demographic and information and all sorts of factors to try to see what really did drive people to enroll versus those who stayed unenrolled. This is a significant and persistent factor. So outreach, personal touch matters a lot in our data. It mattered a lot for people getting health insurance. I'm going to focus for a little bit just on the results of people who enrolled in Covered California. You'll see here that people who enrolled felt, for the most part, that they got a good value, that their health insurance was a good value, and that they feel very well protected by their health insurance. On the other hand, about 1 in 5 said it wasn't a good value. About 1 in 3 say they still feel vulnerable to high medical costs, things to think about for the future. In terms of people's perceptions of affordability and perceptions about what the cost of their plan was, you can see that on the first pie that more people felt like it made them feel more financially secure, not less. A third said it didn't make a difference, but we all know the relationship here between having insurance and having it be an economic issue for families. And so clearly getting insurance mattered for people's financial security. You can see in terms of their expectations about how much they have to pay, about a quarter are paying more than they thought they would have to. 37% say they're paying less. About a third say they're paying what they expected. But perhaps the most important numbers on this particular slide are in that final pie, where we show that among the people who got insurance through Covered California, we know the vast majority of them have subsidized coverage. Still, half of them said that it's very or somewhat difficult for them to pay for their health insurance.
Maureen, can I ask a question? Sorry to interrupt, because this is really so interesting. So the second question, in terms of asking people about the cost, are people aware that they actually are receiving a subsidy? Because I know some of your other research showed a just troublingly large percentage of enrollees with exchanges were unaware that they were even receiving a subsidy. So can you elaborate on?
Yeah, I'm happy to. We have, as you know, we did another project on people who just enrolled in the non-group market, and we found that there was a huge gap between the share of people who knew they were getting a subsidy as opposed to the share who thought they were getting a subsidy. We see a similar situation here with the uninsured. So we know based on their income and based on what they say they're paying that they must be getting a subsidy, but only about half of them think that they were. So when they're answering this question, it's the amount that they're paying. So you can imagine that a lot of these people are getting subsidized coverage and still feeling like, they're on the one hand that it's difficult to pay that, but in here that it costs less than they expected, and some of that can very well be because it was subsidized coverage. In terms of shopping for coverage, people who made it through the process, who got insurance, gave very high ratings in general in terms of comparing premiums, getting cost sharing, finding the information they need. There certainly seems to be some areas of improvement. Comparing the services that could be covered, that's an area where 4 and 10 said that part was difficult. I think many of you who work so hard on getting the website to work so well, and particularly so much better than what happened nationally, will feel good about this finding. Of the people who visited the website, the vast majority of them found it helpful and found it easy to use. We also know that the enrollment methods varied a lot by coverage type, so that, the uninsured who ended up getting coverage through the Medi-Cal program, were much more likely to do that in person, as opposed to the people who got covered through Covered California. Half of them did do their enrollment through the website. I think it's important to remember that, so much of your audience still did use phone or in-person enrollment. And I think one of the big take-home, again, that we're trying to make this point nationally, is that here 6 in 10 told us that they actually needed somebody to help them enroll. So that's a family member, it's a friend, it's your Covered California representatives, it's health insurance and brokers. So again, everything that you all did to enlist the personal touch, it was clearly needed. I think as you're thinking for round 2, when it's going to be even the harder to enroll group left, the importance of the personal touch of the navigators, of the connectors, of all the people on the ground who helped people enroll, it's clearly going to be something that needs to continue to get as much attention and resources as it did in the past. In terms of the process for signing up for coverage, you can see that in general, the blue parts, people thought, the ones who got covered said it was pretty easy. Covered California doesn't look quite as positive as Medi-Cal or the employer-sponsored folks. You still have a large share who said it was very or somewhat, but you still have 4 and 10 who say it was somewhat or very difficult. I know there's a lot of plans to make that easier going forward. Some of the areas where we found that people said they were particularly sort of bumps in the road were around getting confirmation that their coverage had actually started. Certainly that was true in Medi-Cal. It still is true for some Medi-Cal folks, as we've heard today, but it was also true in Covered California. Also getting the issue of realizing whether their income qualifies is another area where there was certainly some room for improvement. The goal for this project is to continue to interview this same population over time. We knew at this stage that many of them will have just started using their plan. So, in fact, about 4 in 10 had told us they had already seen a doctor. You can see here that their initial experiences with their plan were quite positive for the ones who had used. In the later waves of the survey, we know we'll get more information on that as people use their plans more. And lastly, before we move on to
I'm sorry, Molly, and maybe you'll get to this. Do we know, in terms of newly insured, did you all ask questions to explore the extent to which people had never had coverage before, so this was the first time they had insurance?
Yeah, I'll talk about that in a second when we get to the remaining uninsured. But yeah, it's a big, huge part of this population. There's huge
in terms of
literacy.
the newly insured.
The newly insured. But let me talk to you in a second. Just lastly, before we move to the remaining uninsured, there was a lot of concern, a lot of effort to talk about Spanish-speaking materials, about making sure that materials and information were available, particularly for the Latino population in the state. You can see here some of the results. Again, the Hispanics who were newly insured gave us very good ratings and had a lot of positive things to say about their experience. So again, kudos to all those people who worked so hard on that. Let me turn to the remaining uninsured, and then I'll answer your question in just a second about the newly insured's length of time without insurance. This is the 42% that I mentioned at the beginning who stayed uninsured during this time frame, and these two pies tell some very important parts of the story. In terms of income and eligibility, you can see that about 2/3 of that remaining uninsured group gave us information about their income and their documentation status that suggests that they were either eligible for Medi-Cal or for subsidies in the exchanges. 3 and 10 gave us information that suggests that they're undocumented and that therefore not eligible. If we take those undocumented, ineligible out of the denominator and you look at the remaining uninsured and you think about your target audience for the next open enrollment period, you can see about 6 and 10 should be eligible for Medi-Cal, about 35% eligible for subsidies. And these, this next set of pies, if it changes, change. I froze it, sorry. There. This next set of pies gives you a real feel for the demographics of this group. So the first pie tells you the length of time without insurance. Vast majority have either never had insurance, that's the 15%, or been uninsured for more than two years. This is, again, very similar to what we found for the newly uninsured. Their majority had been either long-term uninsured or never insured before. What this means is that these people have very weak or no ties to the insurance market. I believe that means they're going to need even more help navigating, understanding, and trying to figure out. We know how low insurance literacy is anyway. So it's definitely going to be a hard to reach population in terms of not having ties to the insurance industry or insurance in general, those products. And then you can just get a picture for the race, ethnicity, and for the age distribution. I think the age distribution will be interesting given expectations about the young invincibles or the young people and shares of young people. A lot of the audience that's left, the remaining uninsured, are actually in the sort of middle-age group categories. Now, the people who didn't get insurance had a much tougher time trying to navigate the process. So about 1/3 of them actually did try to get enrolled, and they told us they had a lot of trouble finding a health insurance policy, comparing services, figuring out the amount, finding the information they needed. So it wasn't so successful for them. I think there's two main hurdles and challenges that the data suggest. The first one is an information challenge about the availability of financial help to get insurance. If you look at the very bottom of this chart, just 29% of people that we know are eligible or we expect are eligible for subsidies know that they're eligible or think that they're eligible. So 7 in 10 of that group doesn't realize that there's financial help to afford coverage. And whenever we ask this group why they didn't get covered, the number one reason they tell us is they can't afford it. So this information challenge, I think, is something to really focus on with messaging and with information being provided. And then the last big challenge that I know this state has probably more than any other state is the worries about signing up for insurance and what that might mean for drawing attention to the family's immigration status, particularly in families that are mixed status. You can see at the very bottom bar chart there that over 1/3 of Latinos, Hispanics who we believe are eligible to actually enroll in either Medi-Cal or Covered California are very worried or very somewhat worried that if they do enroll, it'll bring unwanted attention to their family members' immigration status. And you can see how much greater even those worries are among some of the other groups of Latino respondents. So as I say, there's a vast amount of additional data in the survey. I'm happy to answer any questions or be available at any other time to talk to anybody about it.
Thank you, Molly Ann. This is such interesting information, and it's certainly in the context of the field poll this week. There's so much to be proud of, but of course, as committed as we are, Peter and I are over here circling the parts where there's room for improvement, and that's what our challenge is, to make it ever better. But I so appreciate your investment in the Kaiser Family Foundation and the trending that you've done, and that have brought us to this point where we can compare where we are to where we were. So I appreciate it. Are there any other questions that the from the board. Kim.
Yeah, well said, Dinah. You all have been just a terrific national and California-specific resource. I just want to pin down this figure in terms of the percentage of the newly insured, Californians newly insured through Covered California. Do we know, do we know the percentage that don't know or do know that they're receiving a subsidy?
I do know that percentage. I have to find it in my big report.
Okay, well,
can I get it for you?
Yeah, whenever. It was a
my
striking
recollection
national
is
figure.
my recollection is it was 44%
that knew.
And so then the rest didn't know, and that our estimates are that the vast majority of them, probably 95% of them were eligible.
Actually,
so there's probably about half that aren't. But I have that actual number in this document somewhere. I will find it for you.
It's a telling figure.
Yeah,
thank you.
Absolutely.
If I could just do a very quick highlight. One of the good things about data is it confirms, as well as some of the things we've known about immigration being a key issue, we can anchor it in that 27% of eligible Latinos are concerned about immigration, even though they're documented. Right. Similarly, the issue about education around the availability of subsidies, and even when they get them, they don't know it, are huge. I would also underscore the data point on that over 56% have been without insurance for more than 2 years. And we talk a lot about it's going to be harder this next round. More and more of the people we're seeking to insure are people that have lived with that culture of coping versus a culture of insurance. And so this kind of data really does very directly inform our planning. And in particular, the other thing that Molly Ann underscored is the importance of those human touches, that community outreach, that talking to friends. And we've found the exact same confirmation in the NORC data, which found that people that have had that community-based outreach were far more likely to actually purchase. So this sort of data is both rich and directly applicable to our work. So thank you very much.
Thank you. And I think it really does support what an amazing job you and everyone in this room and everyone who's part of all the organizations did. I think it really, there's a lot of success story in this data as well.
Great. Thanks, Molly Ann. Peter.
So I'm going to fly through a couple of slides on background. This is the who we insured. We've seen these before. I'm going to fly through them. This is the NORC data on were people aware of Covered California. And the important thing, and again, we need to spend a lot more time on this, but we did a good job across areas. And this is where I know we do need to talk about improving our work in the African American community, but the African American community by survey data, 80% are aware of Covered California from a range of communities, which is more than the Latino community, but the Latino community had the biggest improvement of not knowing in advance. And so that awareness is part of where we've had success. Importantly, the consumer exposure through our outreach and education, and this comes back exactly to the point we were hearing from Molly Ann Brody, is that if people heard about us through our community-based efforts, they were far more likely to purchase. And across ethnic groups, we did a pretty good job. This is our prior investments that we're doubling down on with our Navigator outreach efforts, but we're seeing substantial success, not universal, but substantial success by ethnic groups, more successful in the Asian Pacific Islander community, but in both the Latino community and the African American community, better community-based touches than in the white community. TV, same, generally broad outreach. With that, I'm going to ask Colleen, Armando Azarlazo, and Patricia Chambers. Are they still here, or do they need to catch a plane? They are still here. You guys are fabulous. Okay. We're going to fly through some background pretty quickly to remind you what we're taking some of these lessons from a range of places as we move forward. Colleen.
Oh, you're right. You can't read them. So the main marketing objectives moving forward for this next year are to support the renewal and retention of existing Covered California members. This is where we have 1 million people signed up, and keeping them is paramount. We're also promoting enrollment among the subsidy-eligible uninsured. We have still a major need to build brand awareness and positioning Covered California as the place to go to compare insurance rates that can be trusted. We and it a little bit goes back to the slides Molly just showed. We have to convince people who have never had insurance the value of having insurance and the value of continuing to pay for it. We're also going to do a better job moving forward of coordinating with our people in the ground campaign. So our core target are going to be the subsidy eligible 18 to 64. We're also going to be targeting uninsured households who may not be subsidy eligible, but for one reason or another do not have insurance. And at the bottom of this chart, we're going to be doing the Hispanic population in Spanish, and for the bilingual population, African Americans in English, we're going to be doing the Asian campaign in Chinese, Korean, Vietnamese, Filipino. We're also looking at the bilingual Asian population and doing a little bit of radio in Lao, Cambodian, and Hmong. Where the multi-segment in California is every kind of group that you can imagine. We will also have outreach to the LGBT population and to the millennial population. And I'm going to turn it over to you look puzzled, Kim. I'm going to turn it over to Armando, who's going to do the next part.
Thank you. I appreciate it. And we'll go through this quickly in the interest of time. So, like any campaign, you take a little time after you execute the campaign to figure out exactly what you've done wrong, what you've done right, and you try to adjust and revise. And so we've tried to do that to try to figure out exactly what were some of the retooling that we have to do that's going to really set the foundation for the next enrollment period. So it's a couple of things that we'll want to point out. First of all, we really believe the campaign has to be more integrated than perhaps it was in the first part. Not to say that it wasn't, but we have to put more of a focus and attention, a kind of finer point on the elements of integration. We want to make sure that everything we do is complemented with the full spectrum of the advertising campaign, but we really want to put a focus on that ground game, ensure that it is fully integrated across all segments of the market. Second, we obviously want to make sure that it is anchored against the proper ethnic, regional, and language diversity. We recognize that the diversity of California, it requires us to do this. We think that we did a decent job, and I think the numbers will indicate that and show that. But we want to make sure that when we launch the campaign again, that it is very specifically segmented across the right cultural specific elements necessary in the state. We also believe that it's important to precondition the market for the second enrollment period. We want to make sure that we build momentum for this enrollment period. And so we're going out with a campaign now in September, and we'll follow up as well with when we launch in November. We want to communicate during that campaign the value of health care coverage and the value that Covered California brings to bear. And then finally, seeing all the research that we have seen and studying everything that the Kaiser Foundation and others have put out, we recognize that the in-person enrollment channels are a critical piece of our success, and we want to make sure that we invest properly in developing those channels and make sure that we put enough resources behind that in order to be able to make that even a more important part of it in the second period. In terms of messaging, we call it our strategic duo, and I think we're not walking away from that. We've seen the success, and the research has proven that out. We will go into the market again with two platforms. One is Welcome to Answers, which I think begins to address some of the specific issues and concerns that people have and give them answers rather than leave questions lingering. The second campaign is I'm in, or Tengo un plan de salud, and that plan is the one that is executed effectively in the Hispanic market. We believe that if we properly support each of these individual segments, we're going to achieve three things. First of all, we're going to motivate consumers by driving a message around the benefits and the core positioning of Covered California. Second, we're going to educate consumers and provide them with a depth of information about why it's important to have health care coverage and why Covered California is an important agent in that regard. And then finally, we want to obviously encourage enrollment. With the use of mixed brand and direct response mechanism, we're going to be able to really drive enrollment in the campaign. And then the third thing is, as part of this ongoing research that we're doing and trying to an analysis, there are certain barriers that we want to try to overcome. We clearly have barriers in any campaign that where you're going out into the public and trying to educate them. There are issues that you have to figure out how to address, and we think that we've got to hold a pretty good sense of how to deal with these. But we want to make sure that we really focus our attention around affordability. We need to make sure people understand why quality health care is affordable today more than ever before, that you can get financial assistance for this in order to qualify for the program. Accessibility, and in certain communities that's a more important issue than perhaps in others, but we want to make sure that the power to access and to choose proper health care plan that fits into your needs is communicated across all marketing. We want to also stress the issue of security, the issue of peace of mind. We all know that that in everyone's life there are these what ifs of life that pop up. We want to make sure that we communicate the peace of mind element to this. And acquiring health insurance provides you with that peace of mind, and that's an important consideration as you move forward. Obviously, the educational piece of how to enroll. We want to make sure we promote the self-enrollment, the availability of the resources in local communities, in-person enrollment assistance that's available to people and that is free and confidential. That speaks directly to some of the Hispanic concerns that we've seen. And again, on the Hispanic concerns of immigration, which I know the board has looked at as well, we want to make sure that we communicate the fact that whoever does enroll into the system and has a mixed household, that information is not shared. That is private information, and we're going to make sure that that's communicated across all marketing vehicles. So I'll turn it over to Patricia Chambers, my colleague, who will take you through some of the specific investments.
Tell me how to work this. All right. This first slide just shows that there are multiple touch points, and the combination of using those touch points is how we reach each segment. Each segment, however, consumes media differently. And for example, you can see that for everyone, the top consumed medium is television. It is the most consumed, the most impactful message with a combination of sight, sound, and motion. But you see to the degree of hours that there is a difference between, say, what you see Asians consuming, which is 16 hours in a week, versus African Americans, which are 30. It's on every plan, but we understand how it is consumed. We can message more effectively and extend more effectively. Also know that we've got some going-in strategies for open enrollment, which is currently being planned. We plan to use vehicles that lay a foundation that cover from border to border, from the valley to the coast, statewide coverage of the identified segments. The campaign timing for open enrollment is 11/6 is when the messaging starts, and it goes through 2/15. We're in 13 designated market areas. Those are media markets. Those are not cities. So sometimes that seems to be a confusion. The media market of Los Angeles, as you see, is 5 counties wide. We have multi-segment advertising covering many different audiences in television, in online, print, out of home, in social media, and direct response. We've got layered onto that in-language advertising in Spanish and in the Asian languages. We've got in culture advertising for African Americans, millennials, which is a digital play to reach them, and print and digital and out of home to target LGBT. Not every medium is done in every market, but every segment is covered with some combination of vehicles.
So you're going to stay out of the media market in October? You're not going to compete with all the political ads?
What's going on now, this is for the open enrollment period. Mm-hmm. What's happening starting on the 8th of September is a seeding period, which is basically a time to say, set the date. Mm-hmm. Get your stuff together, because come this date, you're going to be able to enroll. So we're starting that through September and October, going a little bit quiet toward the end of October, and then on that Wednesday after the election, we start the open enrollment with both Glens blazing.
Okay, thanks.
Okay, that's it.
So this was on the marketing side. Before we move to the outreach to the board, any quick questions? Okay. Sarasota Taylor and Diane Stanton on bringing it to the ground.
So good afternoon. We will be very brief in our comments. But playing on what was just discussed with the marketing campaign, we recognize that our service channels complement the marketing in every single way, helping to be the trusted messengers to help build that brand awareness and that communicating that value to our consumers. So since the launch, we have focused on developing outreach and enrollment initiatives as well as the infrastructure to support our service channels. And we concluded open enrollment with over 2,400 certified educators, close to 5,800 certified enrollment counselors, over 12,000 certified licensed insurance agents, 1,200 certified plan-based enrollers, as well as 160 uncompensated organizations that are participating in our community outreach network. Over the next few weeks, we will be transitioning many of our top performing educators and counselors to our new Navigator program, which will integrate further the outreach, education, and enrollment activities. A few of the key lessons that we learned that we will be carrying forward during next open enrollment is partnering our educators, counselors, and agents at events to leverage resources and provide enrollment assistance. And you'll be hearing in a few moments our plans to build further upon that effort. We also heard from our partners that an effective enrollment strategy was to set up workshop sessions prior to having the consumers come in for that enrollment assistance appointment. Aligning our services at convenient times and locations for the consumers. This is also very critical, and we are asking all of our new Navigator partners, grantees, to support us by establishing extended office hours, as well as beginning to set up local storefront locations. We are also working with our communications team to identify real people who can really tell their story of how important it was to get health care coverage and the value of health care coverage. And this message will be tailored to specific segments of our target population. More culturally relevant and multi-language collateral material will also be available for our service channels this year. And lastly, we are developing new training materials for our service channels that will help with increasing health literacy for those that have been uninsured. The next slide is a summary of the NORC covered California Consumer Tracking Survey, very similar to the results that we just heard about from Kaiser Family Foundation, and it further demonstrates that the outreach work of the service channels really did make a difference this past open enrollment. The report validates that those who had community exposure are more than 5 times as likely to enroll as those with no exposure, and also that the campaign exposure was successful across the ethnic groups, reaching 50% or more of our minority populations. So before I turn the slides over to Diane, who will be walking us through our 2015 community organizing strategy, I'd be happy to take any questions. No? Okay.
No, we're good. Thanks.
Thank you.
Thank you, Sarah. Diane Stanton, Deputy Director, External Affairs. So we've heard reference the ground game, and again, just to put some parameters on that, this is a community-based organizing model to really harness the boots that are already on the ground and have that be complemented by all of our media, whether that be paid, earned, or social. So we have a couple of principles that are going to guide us through that organizing process, starting first and foremost with our consumers, and always maintaining their front and center. We will have, of course, 2 audiences this enrollment cycle, both those that will be renewing as well as the new enrollees. We also want to ensure through greater synchronization with internal departments here at Covered California to ensure that we have the broadest outreach for not only our individual consumers, but also our small businesses. We're going to be using analytics and local intelligence to really keep that local focus, because obviously all regions are different, and maintaining that local focus will help us better address those uniquenesses. We will also be facilitating and smoothing our consumer experience by creating a more vigorous support network for not only our service channels, but also so that we can provide the detailed information that our consumers are going to need to make those choices. And then using our service channels and double checking and making sure that we are tracking to our enrollment goals. Our goals, again, through collaboration, always with the focus on retaining and encouraging new consumers who are subsidy eligible, as well as those small businesses and the employees that need health insurance. And our clear objective going into this next open enrollment cycle is 1.7 million enrolled consumers. We're going to be taking the state and we're going to be breaking it down into 8 segments based on our 19 rating regions.
So you can see in some cases we'll have multiple rating regions per segment. In other cases, as we get into Southern California, given the density and the size of those regions, there'll be single unique rating regions. We'll also be starting that community-based organizing that I mentioned. We'll be initiating roundtable conversations starting after Labor Day, and those will continue through the enrollment cycle. Thanks. Any questions?
Thanks, Diane. Nicely done.
Thank you.
Do we have Karen Ruiz in the House? Then I will present for Karen. We're improving CalHERS. It's going to be a lot better. Okay? Thank you. The crowd roars. And it will not be perfect, I am sorry to say, but it will be better. I will note that I have been struck by how hard it is to do a big IT build, how unnimble computers are, but we are seeking to improve usability both in English and Spanish. We have done that, and we'll continue to build that out.
When we did the little field poll thing the other day that Peter mentioned, Daniel Weinberg was with us, and at the end he wrapped it up and he said, "You just have to make it work and do good." So those are our mottos.
That's
now.
exactly.
Make it work and do good.
Is Sue in the House? No. Peter will present for Sue Johnsrud. Service Center lessons learned. And the main thing, and I'm not going to go through the slides, but is, as I noted when I reported out from the board, we will be doing a competitive bid contract to have additional service capacity that will be substantial. We believe that seeking to hit that 80-30 standard, as hard as that is even more important in this second year. In many ways, for some consumers, we have what we call as reputation recovery. We're doing other things in our enrollment process so people can pay upon enrollment. We hope our notices will be better and clearer. Some of the reason why people are calling is the notices weren't as clear as they should be. So we're doing things on the front end, but we are staffing up our service center with the different capacities. And we will follow up on the language mix of our staff, having more multilingual staff and a far deeper bench strength capacity. With that, Tien Lam sure as heck better be in the House. To follow up on our renewal consumer journey, and I just remind all of us, not only is this the second ever open enrollment under the Affordable Care Act, it is the first ever period in which people will be renewing their coverage. And so we're putting a lot of thought and effort with the health plans who have these people enrolled, who are getting people care today, to make sure they stay enrolled.
Thank
Ms.
you.
Lam.
Thank you, Karen and Sue.
My
Welcome,
pleasure.
Tien.
Good afternoon, Madam Chair, members of the board. Tien Lam, and really this was to set up the discussion for the eligibility enrollment proposed regulation. So I think I'll be able to fly through this. I know it's been a very long board meeting, and folks are probably ready to go. So in the
to
past,
hear from the consumers and stakeholders who will comment is what you mean, Ms. Lam.
absolutely,
Yeah, okay.
absolutely. So. Here again, this has been presented to the boards and stakeholders in the past, just reinforcing our guiding principles for our renewal process, which originally stemmed from our eligibility enrollment guiding principles that we developed, gosh, it seems like 5 years ago, but really about a year and a half ago, where no wrong door approach, as well as seamless renewal process. A summary of the decisions that we've made which fed into the eligibility and enrollment proposed regulations, which Ms. Katie Ravel presented earlier. Clearly, our anticipated approach and implementation date of our renewal process will occur in early October. We will be and plan to auto-renew consumers who did not respond to the renewal process, where they do not respond no more than 30 days, and then the eligibility and enrollment regs explicitly in greater detail identify under what circumstances they would be renewed in which qualified health plan. Again, also as noted in the eligibility and enrollment rules, the renewal process for consumers to be maintained within a particular metal tier, for an example, silver. In the event that their APTC or subsidy changes, if they don't make those changes, we would automatically renew them into that coverage. And then renewing consumers who do not provide consent, who are currently in a subsidy, having them being enrolled and renewed into a non-subsidy. While they do not receive subsidies, at least there's they continue to retain coverage and have ongoing care. And then the last couple of points is be able to promote online activities for the renewal process and to promote in-person assistance. And then the last decision point that has been identified by staff here is the need to close the renewal process December 15th in circumstances in which consumers have to actively select a plan because their issuer is no longer available. Then they don't respond by the December 15th. To minimize break in coverage, they still have the opportunity during the open enrollment period to select a plan as well. In the appendix, there's a very detailed timeline of all of the different activities that are occurring. Also, all of our consumer notice touch points, as well as dates in which those notices would be sent and messaging and information that would be contained in the notices. And with that, concludes my presentation.
Thanks, Tim.
So let me just, before throwing it open for comment, the one thing, one slide that Colleen did not spend a moment on is our budget. And I just want to affirm something that we have taken a lot of lessons from meeting in communities. Diane Stanton has facilitated numerable many meetings in communities. We look at the data such as CalSIM, such as Kaiser Family, such as NORC. We've had focus groups that are ongoing. But one of the things the board did in our current budget was to say that in our second round of open enrollment, we will spend more than we spent in our first round of open enrollment. The initial open enrollment was a 6-month period, initial branding. The board, in its wisdom, I think it was the right wisdom, was we will be spending about the same on marketing, across all vehicles and channels, about $74 million for a 3-month open enrollment period instead of a 6-month period. Obviously, the health plans we work with are also spending resources. The philanthropic community is spending resources, and many groups are committed to coverage expansion and are leaning in as volunteers and all sorts of other ways. But we also expanded by $10 million our investments in outreach and enrollment. So we continued our outreach education grants that we made a year ago to those 250 organizations, and through the Navigator program, we're expanding that. It's a shorter period, but it's in some levels a harder lift for the people that still do not have insurance. But this also reinforces, just as Tian Lam was speaking to, the message is to encourage people that have insurance to renew. So our marketing efforts, our outreach efforts are going to be consistently thinking about those two audiences, those that have insurance on why they should renew, as well as those that don't have insurance and to sign up anew. So with that, I think it would be time to open it up for comments from the public on this topic. We obviously will be coming back to this at the next board meeting, but we've been doing a lot of listening, learning, applying those lessons to make sure we build on our relative success in the initial open enrollment as we go forward into the second year.
Thank you, Peter. Start us off.
Good afternoon. My name is Kenna Burke, and I'm with the CMA Foundation. I actually am the director of your Covered California project to educate physicians and their healthcare teams in regards to what's happening in the healthcare world and what has changed over the past year. I really commend all the work you guys do. I think it's awesome. We have not slowed down. A matter of fact, this week I presented, and I'm not usually a presenter, I was out in the field with almost 200 providers and their healthcare teams. So there is still a lot of need for education of physicians, I have to tell you right up front. I also thought the Kaiser presentation was fantastic. What I'd like, if possible, to talk about physician access now in your next round when you do a survey design, specialty access, really being able to get care. Because folks may be happy right now that they have an insurance product, but when they go into the physician office and they can't get the doctor or they have that misunderstanding of it, that's one issue. Having the physician's office also not understand the products or the mirror products is also another huge issue. So I'd like to bring that up. I would also like to extend an offer and to talk with the group in particular about the renewals, because that's a perfect relationship for the physicians to be able to start doing renewals with their patients and discussing that. So I thank you for the opportunity. Have a great day.
Thanks for your support and your work.
Oh, and my purse.
Good afternoon. Jen Flory again with Western Center on Law and Poverty. Just a couple comments on the renewal process. In the plan management meeting last week, there was some discussion about identifying people who are CSR eligible but are either overpaying in gold and platinum or under covered in bronze. And we really appreciate any outreach efforts to those populations. With regards to the timeline and all the notices that will be going out, we've offered several times to the staff that we would love to review the notices to make sure they're in plain English and then as well as plain Spanish, plain Hmong, plain every other language that's required. And then finally, one thing that's come up quite a bit with our advocates in the Health Consumer Alliance and the people that they're helping is the transitions between programs is still not ideal. And so we do have concerns as this renewal process goes on that people can seamlessly get into the Medi-Cal program, and we've been hearing there's been kind of an issue of double coverage, which might become a reconciliation issue or trying to get those premium payments back. And then even more troubling, people coming out of Medi-Cal not being able to get into covered California seamlessly without a gap in care because of programming in CalHERS, which is stopping that. So anything to make that more seamless would really help consumers who are hovering on that line and bouncing between programs. Thank you.
Great. Thanks, Jen.
I feel like we're like the, hardcore here.
Yeah, we are.
Carrie with CPEN. First of all, congrats on the enrollment numbers and the Kaiser data. I think it says a lot about all the great things that you guys have been doing, and also I think is really hopefully very telling in terms of your next focus and who how you need to transition and maybe change messages moving forward, particularly with immigrant communities and other groups as well. So hope to see more messaging coming out of Covered California on that. I want to talk about the renewals. At the health plan management meeting on Friday, I was surprised to hear that the renewal notices are, again, only coming out, my understanding, in Spanish and English. That was a surprise to us. We've been working very closely with DHCS on their notices, and they, are translating all the notices in all the threshold languages. We also see these notices, particularly around, termination of coverage or continuing eligibility. These are vital documents that, require action on behalf of consumers, and so they really, it's even more important than, say, a marketing material that those actually do get translated so people have instructions and know what they need to do. We have, limited funds that we've been able to offer to some of our partner organizations to do community reviews of translated notices. So if you translate the notice, we'll have the community look at it, provide feedback, and make sure that it is culturally and linguistically, appropriate. We'd be happy to offer that, but we just, would appreciate being more of a partner with Covered California as you develop these notices and as you think through the translation process. Thank you.
Thanks, Carrie.
Yeah, I think they call us the winter soldiers. Those who soldier on. Betsy Emholtz from Consumers Union. Just a few comments about the renewal journey. We really appreciate hearing the kind of targeting that's going to go on to really reach those people who might be in the wrong plan and not getting the full benefit they need. That's really terrific. But a couple of other things. We appreciate that defaulting people into a plan is a good way to avoid gaps in coverage, and we support that, but really feel like we want to make sure people get encouraged to shop first, get the help they need to do the shopping. For those who may not appear like they're in the wrong plan, but everybody's, many people are going to go through changes, and obviously the plans themselves have changed. So to add a fifth principle to those four good principles that you all have for the renewal journey, it would be to encourage shop. Shop first if you can. Default is the fallback. One of the default options we heard about last Friday is that some people will end up going, under some circumstances, to a plan outside the exchange, and they may have been subsidy eligible. We know there are federal rules on this, but if there is leeway on keeping people in the exchange until they can get their papers together and verify income, that would be certainly a preferable way to go. Lots of good information from the Kaiser study. I'm just going to pour over that. I think lessons both for the coming enrollment period and for the long-term satisfaction with Covered California. One of the shocking things to me was how many people didn't realize, I think Marianne said, didn't realize they were getting a subsidy. And I really worry about that because of the reconciliation process and the confusion that's going to come sort of year end and getting into tax season. So again, going to look through all that, and congratulations on a lot of the good news. That shopping was easy is a real credit to the, I think, standardized benefits that you all have done. So thank you.
Thanks, Betsy. And to that last point, we saw this in the field poll this week as well. One of the questions that was quite surprising to me was how many people said California isn't doing a good enough job of getting federal funds. I mean, billions of dollars are in California as a result of this, and yet there's that sense that, the feds can always give us more money, or we're not getting our share or whatever. It's sort of related to not realizing they have a subsidy. Those are important, but they're not as important as getting people to know how to get their coverage and how to get their care, but those broader issues are pretty tough to crack. Thanks.
Good afternoon, Madam Chair and the remaining board member, and Peter. I'm Sona Lambic with the National Health Law Program. I wanted to thank the staff again for working with advocates on the renewal process. We know that the federal regs were just proposed. We're hoping the final regs will come out right before Labor Day for fun reading. The National Health Law Program did provide concerns about the federal regs, and we would love to share that with the staff, because the issue about sort of auto-enrollment for those who can't, for those off the exchange, we actually have great concerns and would prefer finding a plan in the exchange in Covered California that's a different plan. And too much onus is given to staying with the same issuer, and we wanted to make sure consumers have choice. We also would love it if Covered California would allow consumer input into the issuer notices that are going out, similar to what the federal marketplace has done. We are also concerned about income dropping for current enrollees of Covered California and the smooth transition into Medi-Cal. As Jen Flory said from Western Center, we're still having challenges with that, and it's also well noted in the federal marketplace these challenges exist as well. Finally, I think the Medi-Cal coordination is important because we are going to have mixed coverage families, those who have maybe parents enrolled in Covered California and children in Medi-Cal. I know we've been working with your staff at DHCS about coordinating the renewal timing too, so that families aren't getting multiple renewal notices from Medi-Cal and from Covered California. So appreciate that. The one last thing is, I don't know if Covered California has the authority, but I would argue you do, to check other income databases other than the Federal Hub and the IRS for income updates. So we would encourage your staff to look at that option. Thank you.
Thank you.
Anthony Wright with Hbex. Very quickly, want to endorse the comments of my colleagues, including what Betsy said about renewals, this balance between defaulting and allowing people to have a choice, making choosing and renewing easier. I think this reinforces the need for ongoing communications with your membership, so that it's not all this information is not all has to conveyed in that small window that you have from November 15th on, but that there is this ongoing dialogue and you build a membership. I love that there's going to be a button on the website that is for members. I think it's really important that what Peter said about reputation recovery with regard to Service Center and keeping those goals high. I know there's a lot of there would be a lot of pressure to try to see if there's maybe a different standard, but trying to keep it that standard is good. One of the ways that we wouldn't want that standard to be met is by de-emphasizing the toll-free number. I think it's appropriate to point to in-person assistance on the website, but I wouldn't want the toll-free number to be, or not the toll-free number, but the number to call to be de-emphasized. I think that's something that's really important, and that a number of people will find that's the best way for them to go through this process, even if for others there will be other opportunities. And finally, I think I would just be remiss if I didn't appreciate the new place and appreciate the Wi-Fi that is provided for those of us who tweet and otherwise to get this message out. It's helpful to have that. So congratulations.
Thanks.
I'll just do two very quick notes to them, which is first, the issues on how many people don't understand they have a subsidy is a very big issue, and we're doing a lot of communication around reconciliation to get people apprised, more informed around that. And the other issue around care, and I really want to do, I know Molly Ann, I don't think is here, but Kaiser Family is specifically doing follow-up surveying on their 2,000 people on how people access care, whether it's in Medi-Cal, Covered California, et cetera. And we're continuing to look at surveying we might do of directly of ourselves on people's access to care, and it's a key issue. With that, I turn it to the chair.
Going once, going twice. I think we are adjourned. Thank
Great.
you, everyone.
Thank you very much.